I'm Matt Handy, and you're listening to My Last Relapse. How's it going?
Good.
So we talked months, it was like in November.
Yeah.
Maybe October.
It's been a long time
Yeah.
that I've been planning to come here.
Yeah.
I was really excited to come here because this is where I was born.
Yeah.
And I have family from here. I still have family here, my mom's family. And my mom's been passed away for almost 20 years.
Mm-hmm.
So I was excited to come and spend time with my family, although I learned a lot while I was here.
Mm-hmm.
I guess I'll just get into it now. I learned that basically a lot of the addiction in my mother's family has been hidden from me forever.
Yeah.
I had, one of my uncles is in full-blown drug addiction right now.
Okay.
And
here?
Yeah, and I didn't know why he hadn't been responding to me for months. This is why. And that's just like a tip of the iceberg of an entire family of alcoholics who have either passed away very young or had health problems due to their alcoholism. And so I kind of always thought that my addiction, and I'm a heroin addict, that my addiction was a cause of like a mother wound that I had from her addiction. And of course I know that logically that DNA has a part to do with it, that genetics has a piece to do with it, but I didn't realize just how far back it went in her family. I mean, we're talking, she has 5 siblings, every single one of them touched, every single one of their children and my cousins touched.
Wow.
My aunt, my grandmother, my grandfather, my great-grandmother, my great-aunt. Yeah, it just all got thrown on the table for me while I was here, which is crazy because I've been carrying around all this shame, honestly, my whole life. And it probably is why I stayed away for so long. And I was so nervous to come here because I thought, oh, great, I get to tell them that I relapsed 3 years ago. I get to tell them that, it's great that I just got off methadone, but I felt like I was going to be a disappointment or let them down.
Yeah.
And that's not how it was at all. So,
yeah, the family dynamics and like the components of it, it's super interesting to hear. Like I hear a lot of different like dynamic systems that go on. And one of the craziest ones that you hear in a family of addiction, like that is addiction like really runs through, is that it's a secret. Like a lot of the time, it's like everybody knows about you, but you don't know about anybody else.
Yeah.
It's really crazy.
Yeah, it is crazy. And I mean, I guess everybody carries some shame about it, and that's why everybody keeps it a secret. But I look at how sick my mother's family was, and then it's hard to not admit that that's how all of that got started, because like apparently one of her brothers was living behind a dumpster when I was just a little girl, and he had come to move to North Carolina to be, I thought, just to be closer to my mom, but it was actually because he sort of was convinced to go to North Carolina to try and
sober up.
Yeah, sober up, get himself clean. My other uncle basically offered him his Camaro to do so.
Oh.
So he did, but so I grew up as this little girl thinking that these people were like
normal.
Yeah, I looked up to them, and it's, not that wasn't okay, for a little girl to look up to her uncles specifically, but just to know that we're all really the same inside. I mean, we all just have the same struggles, and I mean, we don't all go through addiction, but we all deal with pain.
Yeah. Addiction is interesting to me. Obviously, it's like all I talk about, but like on and off the podcast, it's like literally all I talk about. But drugs and substances, just in general, have been a part of the human experience for forever. Actually, honestly, like, and if you buy it, do you know what the stoned ape theory is?
Yes.
So if you buy into that, like, it actually made us who we are, right? And so it's like there is this thing that has this like linear continuity between like that ran alongside us, right? And actually like influenced who we are and probably caused wars and peace and like all kinds of different stuff, right? And it seems to me that addiction has probably been around forever, but like with the scientific age that we live in, like we've started to define things and actually like find the causation of things, and like we've been able to really define what addiction is. And my question is always like there's been homeless people for thousands of years, right? And it wasn't really even homeless people, they were just like people, right? Like think about like 2000 years ago, was a homeless person classified as like a person without a home, or were they just like somebody so poor that they just lived on the streets? And was it normal? Like it seems to me that it was just normal to have people that were homeless. And I don't think that addiction probably played into that. And now it's like almost across the board, addiction is playing into homelessness.
Yeah.
Right. And it's like, what has actually changed that causes that to be like isolated within that specific demographic of people? Right. And what I really think is that like when people are ignorant of facts, right? Like good intention and ignorance seems to go hand in hand, right?
Yeah.
So if we are just ignorant to facts scientifically around addiction, then is there like other assumptions that go past that? So like now we look at alcoholics starting in like the 19th, like, you know, probably a little bit before the 19th century, especially like in Europe, alcoholism became like a fucking problem, right? But as that evolved, we've like isolated it into this problematic situation, right? Where it's like, is the addiction actually the problematic piece of it? Or like, is it the societal components? Like, what actually is it? And has addiction really been here for that long? Or is this like a new phenomenon?
I think I think addiction has definitely been around that long. I think some of what's changed is not just the way society looks at it, but also how we get dopamine these days.
Yeah.
You know, like I know definitely people have used substances forever. And I was actually just listening to a sleep story of all things the other night that was talking about how the Victorian era was just full of women on drugs. But I think that if you look at like ancient Egypt or something like that, societies that have a lot of manual labor maybe, or I'm sure there's other components like women that are still encouraged to be nurturing, and I don't know, maybe even hunter-gatherer type people. They all probably used substances, but they didn't need to seek the constant pleasure hit of dopamine, I think,
For sure.
because they had more serotonin, which...
Yeah, also, like, when you go back that far, like, the 21st century affords us the luxury of addiction, I feel like, right? Like, back then, it was, if you don't hunt, if you don't gather, then you die.
Right.
So they didn't really have, like, the luxury of, like, mental illness probably even either, right? It's like, and I'm not saying that, like, mental illness, like, suffering from mental illness is a luxury afforded by like how comfortable we've become, but it is something that people can focus on because they are no longer trying to survive.
Well, we've started treating mental illness differently too.
Oh yeah.
I mean, I know that I've read back in the day that, and even pretty recently, just other cultures, indigenous cultures, treat it differently. Not like it's a problem and something to immediately get rid of, fix, or solve, but rather figure out how to integrate it.
Yeah. Yeah. I mean, mental illness is an interesting one because it's like, so I'm not are you religious?
I'm very spiritual. I wouldn't say I'm religious.
Okay. So, when I look at the Bible, right, like, and just to be transparent, like I was raised Mormon, I was raised on the Bible, I was raised like very Christian, and so I went to seminary and like got to study these texts, right, And I like fell out of the church and then was like militantly anti-Christian. And now I'm like heading back in this direction of like logic, and logic seems to kind of point me in the direction of the God of the Bible. But so that being said, if what was going on in biblical times happened today, we would put those people on medication. Like
Oh,
anybody
certainly.
that was like, "Oh, I talked to God and we have to leave the city," right? We'd be like, oh, "Dude, this guy needs medication."
Yeah.
Right? It's like all of these prophets, all of these people like of God, if they, I mean, there are these people today. They're out on the streets being homeless today, right? It's like this is what we would look at them as today. And so it's like not only are symptoms of mental illness looked at very differently, but now that we're able to, that's the other part about it too. It's like the study of the mind is so not scientific, right?
Well, it's subjective a little bit.
It's all subjective because you could have the same symptoms as me and we can have completely different diagnoses,
Yeah.
right? And then it's like there are
And it
some
happens all the time.
all the time, all the time. As a matter of fact, Dr. Shaw, Dr. Shaw, do you know who he is?
Yeah.
Okay. Uh, Dr. Shaw, um, the average length of failure of medications before he starts treating people the way that he treats them is 14 years. So for 14 years, you're experimenting with doctors and medical professionals around the medication that you're on to address your symptoms. And for 14 years, it fails before most, and actually it's not even most, before somebody like Dr. Shaw will recognize the actual issue.
Well, that tracks for me. I mean, I've had a lengthy history of mental health diagnoses, starting when I was a teenager, after running away from home a couple of times. But um, I think that I mean, I've been diagnosed with everything from ADD, anxiety disorder with OCD tendencies, bipolar disorder. Um, yeah, all of those, and none of them ever actually really felt like they fit me. And I spent the better part of 10 years coming on and off of different psych meds.
Mm-hmm.
A couple of them actually put me in to psych stays
Mm-hmm.
when I was in my early 20s. Um, and so eventually I was the one that had to advocate for myself and go, this stuff doesn't feel right. Also, I started self-medicating.
Mm-hmm.
And I think that's what happens to a lot of people. Also, there was this big trend, I think, in the early 2000s where diagnosing people with things like bipolar disorder was very common. It was just, but they weren't looking at trauma. And I think we know now that trauma can mimic things like bipolar disorder and
Yeah.
other personality disorders.
Mm-hmm.
So you don't necessarily need to be medicated for trauma. I don't know. I'm really I support anything anybody wants to do, but I've become pretty anti-medication for myself.
Yeah. Yeah. I mean, yeah, that's a good way to put it for myself, right? And I think that, so here's a thing that happens pretty fucking often is that people go to treatment and they will leave treatment with multiple diagnoses. And typically it's depression, anxiety, right? And it's like, I'm sure you've heard me talk about this, but why are we diagnosing people with depression and anxiety who have earned depression and anxiety? Like they are coming off of substances, their brain chemistry, their emotional regulation, like their coping skills really dictates that they are going to be depressed and they are going to have anxiety. And now we're diagnosing them and putting them on these medications that if you don't have these clinically, it will give you depression or anxiety, right? It's like, do we not see the cycle that we are propagating within the treatment industry by itself?
I don't think we want to see it. I don't know if it's pharmaceutical companies. I've heard you talk about who everything is owned by.
Yeah.
I think that I don't think that it pays for them to actually try to fix things. I think that it's just that simple.
There is no money in healing.
And we're more concerned about like acute symptoms, acute pain and things like that. And we don't really, I don't think it's talked enough about at all, things like intermittent withdrawal that you experience even when you take the medication at the same time every day that you're told to take the medication. And so that can end up making the symptoms swing up and down.
Yeah.
And you can't really ever find homeostasis.
Well, so homeostasis specifically is the state that you are born into, right? And so nobody is born, I mean, okay, some people are born under the influence of drugs because of their mom, right? But like that is not what homeostasis actually is. We are born drug free, right? Chemical not depend, like the opposite of chemically dependent, right? And so it's like when we talk about like what is homeostasis for somebody with a chemical imbalance, well, the chemical imbalance is their homeostasis, right? And it's like, yes, we can use these tools, and this is a problem that I see like systemically within the treatment industry, is that we are not using it as a tool. We are actually using it as the solution, right? Where it's like, this can help us bridge gaps between like a chemical deficiency back to a normalized level, like brain chemistry level. But that's not what's happening. People are ending up on these medications for decades sometimes. And then when they come off of it, they are really whacked out, right? It's like, this is damage that we are actually doing to people, right? And it's like this whole conversation that I have around, you are either helping or hurting. And if we are not helping, then we are hurting.
Well, it makes me wonder about the question you asked earlier about what's causing addiction rates to go up. And
Yeah.
I mean, that could be one of the reasons, is this terrible treatment we have for mental health issues.
Yeah, I think so. Not everybody who has mental illness issues has addiction issues, but everybody who has addiction issues has mental illness issues.
Sure.
Bottom line, right? And so I just talked to a teacher, and from the teacher's lens, what he is saying is that the public school systems are a major contributor for adult addiction, right? That there's downstream effects of taking people's ability to create and explore and like be an individual. Like you're robbing them of their individuality, and that is helping push people down these roads towards outside solutions.
That's interesting, because we're being taught to be inauthentic. We're being taught to perform. That's a big... Performing is something I cannot stand anymore. And I think that it kept me really sick for a long time until I was ready to sort of extricate myself from the situations where I felt like I had to make these really perfect performances all the time. Yeah, I think that and then, let's go ahead and talk about the methadone. Because,
Sure.
At methadone clinics, they don't really address the mental health portion either. And they also are very driven to keep you on the medication. It's been my experience both times that I got off methadone that the doctors really weren't supportive of my decision to get off methadone. It was really seen as, well, why do you want to get off methadone? Because I'm doing well. But if you're doing well, then why do you want to get off methadone? You should stay on the methadone. This is going to be... And then they don't want you to sort of drive your own taper. And I don't think that's... Maybe they have good intentions, but I've decided that nobody understands what it's like to withdraw from some of these medications, antidepressants included.
For sure.
Unless they've actually been through it. It's very subjective. A lot of people have different symptoms because it's all nervous system related. And I've had psychiatrists tell me that I shouldn't be experiencing withdrawal from Paxil. I've had my methadone doctors look at me and shrug their shoulders, like when they ask how I'm feeling, and I say, well, I've got all these symptoms. I don't even necessarily... I'm not asking them to manage it, because coming off methadone just sucks. And I think there's a part of that you just have to accept. But they always look very confused. Like they don't even know what symptoms you're talking about. If you ask, is anybody else experiencing this stuff? They don't know. A lot of, unfortunately, in that setting, there's not even a very high success rate. So that might be why they're unsupportive. I think a lot of people are sort of jaded in the field, and I understand why. I do understand why, but I think
why do you think that is?
Well, so I'll tell a story briefly about when I went to Florida to some treatment facilities. I had a counselor there named David, and he had been in recovery for 20 plus years, but he was a dry drunk. I mean, that was my experience of him. It was everybody's experience of him. That was pretty clear. And we would get in our small group settings, and he would literally just look around the room and each of us one by one tell us, about all our trauma dumping, everything that we were doing wrong, that we might as well just leave if we didn't want to stay. He said some crazy stuff, actually, and a lot of people ended up leaving the facility because of it. But I understand that it's because he worked at this facility in Florida called Renaissance that had this super high turnaround rate. And a lot of the people in that recovery bubble in Florida, like if you're not active, it's like the whole other part of the population is people that are screwing up, basically. So a lot of people leaving those facilities and going and living under bridges, a lot of people leaving and dying, a lot of people that I was there with are dead.
Yeah.
And you see that enough times, I think it starts to feel like you don't know what you can do to help. And I think about myself when I was in my early and mid 20s, hell, even in all of my 20s, you couldn't tell me. I mean, you could tell me whatever you wanted, all the consequences, but it didn't matter. I'm in awe of people that get sober at 21 and just stay sober. That wasn't something that I could do. It wasn't even something I wanted to do. I still had stuff to figure out,
Yeah. So before I say this, I like to preface this with, I do believe that the average addiction professional has good motives. Okay. But, okay, not even but. So that being said, the treatment industry does something very specific. They treat symptoms, right? They try to alleviate consequences and treats symptoms, right? What we are actually fucking terrible at is keeping people clean. I mean, terrible at it, right? And William White said that in the history of addiction treatment, never has anybody ever gotten clean in treatment, right? There is work that gets done in treatment that treats like acute symptoms, right? And this is kind of like what you were saying earlier, is that like we are an industry that it's the behavioral health industry that is the bridge between the pharmaceutical industry and the medical industry. Specifically, what I believe happened was that really smart people had to figure out a way to monetize a specific demographic of people who don't traditionally receive medical treatment or pharmaceuticals, right? Like, how are we going to monetize these 40 million people that use drugs? Right? How are we going to do that?
That's awful. I mean, knowing stuff like that can just make you lose faith in the world, honestly. And that's part of why I sort of lost faith in the industry, because that's all that I've experienced and that's all that I've seen. And look, I think the industry needs more people in recovery to be working in it. the sad truth is that a lot of them relapse, and
Mm-hmm.
then that's been my experience. A couple of years later, you can't find them anywhere. So we all struggle, and I think that that's why I had to finally realize that there's nothing to be ashamed of about my last relapse, even though I lost 7 years of sobriety, because that's what life is.
Mm-hmm.
Like it's up, down, trials and tribulations, pain, happiness. And I'm just, I'm just happy that I can actually be present.
Mm-hmm.
You know, I certainly wasn't present when I was using at all. In fact, probably like a lot of people, I felt like 20 years just went by and like the
Mm-hmm.
blink of an eye, and I woke up and I didn't know what had happened all this time that I lost. I think that there's some meaning to be found in that, though. I
Mm-hmm.
think that I'm 43, so I've kind of been on this midlife kick lately of figuring out. I just read this book called The Middle Passage by James Hollis. I'm not sure if you've heard of it. It's kind of like a Jungian take on midlife, and it talks a lot and why it's so stressful for some people, and it
Mm-hmm.
talks a lot about how basically the minute we're born, from the minute we're set on the floor as a toddler, like, well, from an infant really, a lens is put over our eyes
Mm-hmm.
by our parents, and we spend the whole first half of our life trying to figure out how to get that lens off, and that's after we figure out that it's there in the first place.
Right.
So I think that there's some meaning to be found in that all of that pain that happens in the first half of life. I mean, if there's not pain there, I'm not sure exactly what midlife looks like. In fact, I think it could be more painful
Mm-hmm.
when people realize just how fake it all is, like what an illusion it sort of is.
Mm-hmm. Yeah. I'm 37. Okay. And when I made the choice to leave my family, I was 21, 22, somewhere around there. And so do you remember that movie that it was called Into the Wild?
I remember it. Was it with Liv Tyler or something?
No, it was with Emile Hirsch. Sean Penn produced it. It
Oh,
was based on like a true story of this guy who, dude, he was like, his dad was like a rocket scientist at NASA. His mom was like a high performer too, and he like went to Emory and then got accepted into Harvard Law, and like in that summer between his graduation and then going to law school, he left everything. Like he left everything behind and just kind of like went on this hippie adventure. Like hitchhiked all the way across the country, like hitchhiked all the way back to like Nebraska, hitchhiked back to the West Coast, like ended up in Washington State, and then like hitchhiked all the way up to Alaska, and then like got lost in the Alaskan wilderness, and then like died from like eating something that poisoned him.
this was his sort of meaning journey.
Yeah, absolutely, for sure. And like I was 17 watching this movie, and I saw it almost 20 times in the theaters, and I was already like living on my own, already addicted to heroin, and I just remember like sitting in the movie theater by like literally nobody's in there because I had just seen it so many times that like this is the tail end of its airing, and like crying to myself, going like realizing that I was going to end up doing this, that I was going to have to like go out on my own and figure it out. And I was already kind of like on this journey of like figuring it out, but I knew that it was going to get really extreme, right? Kind of like what this guy went through, right? And when I look at like today's society, and you're talking about like the lens, like that lens that gets put over like our children's eyes is the lens of what our parents want or expect from us, right? It's like today it's really convoluted because everybody wants to be a social media influencer. But like 20 years ago, it was like, you got to go to college, right? You got to get married. You got to have kids. You got to have the career. You got to have the house. You got to do this. You got to do that, right? It's like, and then everybody lives their life in accordance, especially for the first half of their life, in accordance with this vision that is completely arbitrary, right? Because it's like, if your parents were lawyers, you wanted to be a lawyer. If your parents were doctors, you wanted to be a doctor. If your parents were a vet, you wanted to be a vet. If you, whatever, if they, whatever it was, right? It was like, it's like that whole, like Socrates, right? When he started his like philosophical journey, he went around and asked everybody like, what is the meaning of life? And what he found out was that, like, if you were an artisan, the arts was like the meaning of life, or if you were like a doctor, like healing people was the meaning of life. And he realized really quickly that life is basically meaningless, like unless you give it purpose, right? And then he goes like off on like the Eleusinian journey, and like the Oracle at Delphi tells him, he was like super young, and she tells him like, you're the wisest person in the land because you broke free from like dogmatic thinking, right? Like you broke away from like thinking that you had to do X, Y, and Z in order to be successful.
Right.
And his reply to her was, I know nothing, right? Like, how can you say that I'm the wisest person in the land when I know nothing, right? And it was like, wow, that's who, like, one of the fathers, like, everything pre-Socrates has a name that it's like pre-Socratean philosophy. And then post that, it's like, this is where modern philosophy comes from. Like, all started with this person who had this acknowledgement of like, life means nothing unless you give it purpose. And like, ultimately, like, we all know nothing.
Yeah, it's up to the individual to figure out what that purpose is. We can give people sort of a vague roadmap, but I don't think we can tell them what pit stops to make.
Well, also, like, the roadmap kind of assumes a destination, right? And it's like, the life that I'm living today, okay, was not what my parents wanted or planned for me, right? And if I would have done what they wanted me to do, I would have been fucking miserable, right? Not to say that I wasn't miserable at times in my life, but I am now 37, and I'm basically where all my peers are at professionally, right? And it's like, so I did 20 years of everything that I was doing, and I still ended up in the same fucking place that they all are.
Right, you just had a different path.
Totally different path.
I think that, yeah, I had a lot of expectations of me too that I probably, well, I know for a fact I didn't fulfill those expectations. My father's been telling me how disappointed he is in a lot of things for a long time. He doesn't do that anymore now. He's very proud of me because I've stacked some successes. But yeah. I'd say a lot of my early life was me sort of being a disappointment and being what I really thought was the black sheep of the family. I mean, I have spent so much time thinking and talking in therapy about how affected I was by that because I, like.
And it was all an illusion.
It was all an illusion.
Yeah.
Yeah. Because even, so my mom's whole side of the family is screwed up, but even my dad's side of the family had their own issues. I think that maybe they came from a different time, but they were definitely people that drank every single day at 4 or 5 o'clock, had some liquor. And there was definitely some, emotional dysfunction that occurred in that family. I think that it's really unfortunate how much we pass trauma on to our children, to our grandchildren, and ways that we don't even know. And all of those expectations, just even little things. It's so funny, like a grandmother telling you, how to be, have proper etiquette so that you can date a boy. I think, I used to skate, and I had older women in my life telling me that I would never find a boyfriend if I skateboarded and dressed that way because it was like this masculine thing to do. And then I had a whole sort of identity crisis around that. I have really let all of that stuff go at this point because I am who I am, and I think that for all of the mistakes that, well, I hate to even call them mistakes, but
Yeah.
because I learned from them, but I had positive consequences and negative consequences from everything that I've done. And I'm not sure that I would change any of it. People probably say that on here all the time, but I genuinely feel that way because I feel like it's kind of interesting because I feel like a lot of addicts are super introspective. We get to that place where we have to be. And I think that that's afforded me a level of understanding about myself that some other people around me don't have. And I really value that.
Yeah, addicts in general. This isn't like it's a generality, but I'm not saying this is true 100% of the time. But we have this benefit of our experience, right? And everybody has the benefits of their own experience. But what across the board, everybody that enters recovery has this single benefit in, I mean, all of us do, right? It's like we are approaching the solution from the problem, right? So we lived our life in the problem for so long. We are able to do things, willing to do things, and can do things that the majority of the world would never even consider, right? So because of that, approaching the solution from the problem, we have a completely different lens on what solutions actually are, right? Because the majority of the world stays in solution and never approaches the problem. Like they actually stay in the solution at all cost, right? And so the introspection that we are afforded, it's like almost a necessity for addicts like pre-recovery to start examining themselves in a way that is not normal.
Well, it's kind of like saying that hardship is a precursor to growth.
Yeah, yeah. Well, who said it? Maybe Aristotle said it. An unexamined life is not a life worth living.
I agree. I agree. I think that that's why we're here. I think that life is about examining ourselves. I mean, I'm spiritual. I mentioned that, and I sort of believe I if you want to call it God, I'll call it God. But I believe that there's like a source energy that we all go back to at some point, and that really our only point of being here is for that source energy to experience itself, which is us. So if you look at it that way, that what else is the point of being here? And everybody's going to have a different way to facilitate that, whether it's learning through their having children, or maybe they struggle with housing or homelessness, poverty, addiction, depression, actual real illness. Yeah, success. I mean, I actually very recently, this touched me. There are touched my life personally, but there are so many men that are middle-aged that have so much success that they have just achieved all of their career goals and they're still suicidal. They wake up and they go, well, I achieved all of this stuff that I thought was going to do something for me, and I don't feel any different. In fact, I feel pretty hollow and empty inside. And I think a lot of people don't know what to do with that. I mean, even addicts don't know what to do with that sometimes. That's why they end up using drugs.
Yeah, pre-addiction. Yeah, so when you get down to like not like examining these situations on like a base level and go like take it to like its most logical base level, right? Now what we're actually talking about is like moral grounding, right? Like, and most people in today's world are not morally grounded in anything other than feeling, right? Like, oh, I feel like murder is wrong because for whatever reason, right? It's like, but can you actually tell me why murder is wrong? Most people can't actually tell you why murder is like ethically wrong other than it's illegal,
Right.
right? It's like, so now, like when you look at that specifically, like is murder wrong? Like, is it wrong to take another person's life? I can give you a million hypotheticals where it's not wrong, right? So then what is the threshold breaker around what wrong is? And now it's actually, well, what is bad and good? Like, actually, like, epistemically, like, how do we know what is good? How do we know what is bad? Most people, it's just like, well, it's because of what I feel. Okay, well, why do you feel that way, right? It's because we've been really programmed and like been made to feel that certain things are good or bad, like socially, emotionally, whatever. And again, it goes back to like this lens of like what. So if you were raised Mormon, you're gonna think that like sex outside of marriage is like you're gonna go to hell for this, right? And then you talk to like an atheist, and it's like they base all of their entire life's drive on like hooking up with as many people as possible, right? And they don't think that it's wrong. But like you have these two completely opposing ideas, and one person is completely convinced that it's wrong, and the other person is completely convinced that it's not. So it's like, what is the threshold breaker for what is good and what is bad, right? And if you're not morally grounded in something other than feelings, there is no justification for anything to be good or bad. And this is where we find that, like, specifically dealing with suicidal men today, um, especially around like successful men that have careers that are high performers. There are duties and obligations that are baked into our DNA, right? Like men have different like obligations than women do,
Sure.
right? And when you are not satisfying these things, and this goes back to like who we are primitively as creatures, right? Like there are actual biological drives to have kids or provide or whatever, right? And when you're not satisfying that, I think that a lot of male mental illness comes from the nature of men going unsatisfied, right? So now you have anxiety, now you have depression, and you can't tie it to what you've failed or succeeded in, because I know people that have failed that are content, and I know people who have had massive success that are suicidal.
Yeah.
Right. And it's like, so now what it really all comes down to, for me at least, and this is why like I'm going back to a logical place of like the God of the Bible, is because I can morally ground there's a logical answer for what is good and bad. Right. And it's like I can now actually like give you like an ontological reason for why something is fundamentally good or bad, based on a belief system that maybe I'm right, maybe I'm wrong, or maybe it's just beneficial to assume that it's right because it helps me live in a more moral like framework.
Well, there's core sort of tenets and commandments in the Bible, right? I think those commandments exist in most religions, very similar
Sure.
commandments. So I think there's an argument to be made, like whether or not religion created the values or whether the values created religion as a way to perpetuate.
Sure. So now, like within that dilemma, right? Did the morals create the religion, or did the religion create the morals? Absent God, it's all subjective anyway, and none of it really even matters, like at
Well,
all.
if you don't believe in anything, if you believe that you're just gonna, I think maybe one of the more dangerous beliefs is that when you die, you just die. Like it's like
For sure.
going to sleep and nothing matters. Because then it's sort of a blank check to just fuck around.
Yeah.
I mean, I've seen it a million times. Like I always stayed really close to values in my addiction. I was sort of always known as like the do-gooder heroin addict. You know, I was always the one that only used clean needles, would give them to people. I would also, you know, well, not that I haven't gotten into my fair share of legal trouble, but at a certain point I got, and it was probably because of the legal trouble I'd been in, I didn't want to be around anything. I was using the drugs, but I couldn't even be near somebody that was shoplifting. And that obviously maybe didn't start as a value. It started as sort of an anxiety response, but it turned into a value over time, because then I started being like, well, you definitely shouldn't steal from a mom and pop shop. Or maybe you just shouldn't really steal at all. And then maybe you just really shouldn't lie at all. Maybe there's no actual point in lying. I don't think that I've ever benefited long term from a lie, only short term, you know? I think that most of the lies I've told were just to get me out of one moment and into the next. But over time, just sort of detaching from those behaviors actually gave me a value system around it, because I started recognizing that it felt good to not do those things. And then I'm sure a lie or two slipped out, and it was like, well, that actually felt bad. I need to correct that right away. And I actually went through this phase where I was constantly sort of coming back and correcting things with people. And
in your addiction.
In my addiction and in recovery, when I started having all of the, you know, when my values really, really changed, I didn't feel like, well, let me just say this. All of that behavior just kept me sick. I mean, because then I would end up feeling like I needed to self-soothe in some way. Then I would feel like I needed to isolate because I would have shame around it or something like that. And I think especially when we actually are clean and in quote unquote recovery, and then we do something like that, it's like even more, it hurts just ourselves even a little bit more than it did before, because now we know that there's no reason to be
deceptive.
Yeah, deceptive. And it really just keeps, the only benefit in being deceptive is to keep yourself hidden, which is maybe exactly what addicts don't need to be doing. I mean, at a certain point, obviously, when you're in active addiction, that's the goal. But in recovery, we can keep trying to hide, and it's pointless.
Yeah, so the quality of the recovery is, in my opinion, what's under the microscope, right? Or it's like, you'll never be more sober for most substances than you are after day 3, right? But you can be more recovered constantly. So for the recovery at day 3 to be the same as the recovery at day 30 with no evolution, I see that as pointless. And then for like the recovery to be the same after like year 1 to year 30 is totally pointless.
Yeah, well, I think that if that's what your recovery looks like, you're probably not going to keep your recovery very long.
Well, there are people, right? Like your counselor, right?
Well, yeah, but so I would make an argument that, so are those people in recovery, or are they just sober?
Yeah, so this is why I say the quality of recovery is what's under the microscope.
Right.
Because I know, like, for that specific example, for somebody that's an addiction professional who is literally, like, they think they are in the business of saving lives, where I've seen this, right, where they will justify their inadequacies by helping other people, right? So he's like, I am perfectly fine not using today and going into the situation and trying to help other people so that I don't have to work on myself.
It's his 13th step.
Yeah, minus the sex, right? It's like,
excuse me. I mean his 12th steps.
Yeah, so
His at his service.
Yeah, but even still, so No, I wouldn't say that it's a 12-step effort. What I would say is that it is a like a self-motivated return on investment, right? Where he's like, I'm going to do this to not use. And if I help people, good. But the reality of what he's doing is just keeping himself off drugs and alcohol.
He doesn't really. He doesn't actually care about the patients. It's just himself.
I
This
mean,
is
yeah,
what
you
I have
can.
to do to stay clean, and I'm going to
Yes.
do that at all costs.
And for those people, what I always tell people is like, if you're not going to help people, like, recovery is fundamentally a debt, right? You incur this massive debt, and the only way to pay this debt is to help other people, right? And so if you're going to get sober and not help other people, then you might as well just stay using, because it's really just pointless to because you're living a pointless existence.
I think people that work in the treatment industry also need to start recognizing that each individual is so different, like we were talking about, and their recovery has to be built so differently. And I see that in a lot of these inpatient centers and treatment facilities, they really sort of heavily push the same agenda with equal force on a lot of people, and hoping that just, they're going to be able to force a fit. But what they end up doing, like we said, is just sort of pushing people, kicking people onto the ground so that one person can get through, and then that person may not even end up staying sober.
Yeah. So the problem with this is that the average addiction professional actually has no say in what they do.
Yeah.
Right? It is not on the addiction professional to answer for the system, right? It's the system needs to be critiqued and questioned and then altered. And there's only three groups of people that have that power, right? It's owners, investors, and payers. So people who own treatment, people who invest into treatment, and the insurance agencies. Right. They are the only people who can actually change the direction of. That's why I always ask this. Do you know what value-based healthcare is?
No.
Value-based health, just to kind of sum it up, is that if you go to the doctor for a surgery, right, insurance pays for the surgery the first time, but if they have to have a second surgery, then it's on the doctor, right? So if you apply this to the behavioral health space, right, if somebody goes to treatment, right, the insurance pays for that. But if they have to go back a second time, it's on the treatment center to pay for it. Do you think that people would ever need to go back to treatment a second time?
I want to say no, but I also want to say it might just increase the length of all treatment stays to those 2 year long programs.
Why do you think that is?
Because that's probably what most people need.
Okay.
They need to be separate. They need to be taught an entire new lifestyle and an environment. They need to be given time to figure out what what they find meaning in, even just to rediscover hobbies, simple things. They need time to figure out how they're going to go back into their family, because you can be given so much time and it may never be enough when you're looking at the fact that your family, and let's not just talk about family. Yeah, we come from sick family systems, but what about all the other people in our lives that aren't in recovery, that just have poor boundaries or don't recognize when you put out your own boundary? And
Sure.
that stuff can be really triggering. So I think being away from it as long as possible is good. But the majority of people, especially people that are compelled to go to treatment, would have a heart attack if they get compelled to go somewhere for 2 years. Some people probably don't go, and then. But I guess the ones that stay, I don't know. I knew somebody that went to a year-long program and he didn't stay sober.
Mm-hmm.
So, but he actually is sober today, and he's an accountant. So it's not like it didn't do something. It definitely put an idea in his head and gave him the belief that he could accomplish something.
For sure.
Because those programs aren't easy either.
Yeah, so my last treatment episode was 3 years. I was in treatment for 3 years straight. And pre-85, do you know what the treatment industry was called before it was called the treatment industry?
No.
The field of recovery.
Okay.
Okay. And
That's
then,
a better name.
well,
No?
no, because that it actually was the field of recovery. Today, we are actually a treatment industry, right? So it actually matches what we're doing versus like if we called us the field of recovery, that would not match what we were doing. Like it wouldn't descriptively fit what we are doing in treatment. Does that make sense?
Right. But even though you're treating people today, a lot of it's with medication, like we were talking about.
Yeah. Well, so look, 10,000-foot view of what treatment does. 28 days. You can use addictively for 2 weeks, and 28 days would never scratch the surface of what's going on. And so it's like you can go to treatment for double the amount of time that you used for, and it still wouldn't fix it. Okay? So 28 days. Do you know how that happened?
What happened?
The 28-day model became normalized?
No.
This is so crazy. So,
Love to know.
20 years ago, they had to find a way for professionals to go to treatment and not expose that they were going to treatment. And so they could take 2 weeks off vacation time and get 2 weeks paid vacation time and not lose their job.
Wow.
And it was the same in the military. There was like leave and then paid leave that equaled basically 4 weeks. And so the insurance companies saw that like this was basically all that they can monetize from the people who could afford it or from the people who get paid for to do this. And they just normalized the 28 days.
So do you think like methadone doctors and Suboxone doctors, MAT doctors, do you think that they are more motivated to keep people on the medication because of financial incentives, or do you think that they have also become sort of skeptical that anyone can actually stay clean without it for any significant period of time?
So I don't want to conflate what's going on and like make a causation correlation thing, like fallacy, right? There's multiple components to what's going on with these doctors. First and foremost is most of these doctors that own these clinics. In most states, you have to be a doctor to own a clinic like this, right? Most of these doctors have no formal education. These are some of the most educated people in the country, have no formal education around addiction. The average primary care provider, physician, gets an average of 6 hours of addiction training.
Yeah, that's garbage.
In the 12 years of post-high school education that they get, right? So 6 hours is what they're getting on average. Obviously, if you're going into like a specialty area of medicine, like there's a little bit more training, but the problem then becomes that they are not in recovery. And then the problem becomes statistics, criteria. There's also incentivization, right? Like there are like money incentivized, like this gets incentivized, right, to keep people on medication. But then in addition to that, what they're looking at outcomes, long-term outcomes, short-term outcomes. Like they're trying to measure what is successful versus unsuccessful, and what they are seeing for sure is that when you are on an MAT protocol, the likelihood of you overdosing goes down dramatically. Not that it's going to keep you clean, but that the chances of you dying because of an accidental overdose or like substance exposure goes down, and that is a huge metric around success. And then the other thing is that the guy that developed Suboxone, that like the actual person that created Suboxone, created a plan for it too. That was 2 years, right? There was like the induction phase where you're like saturating, you're stabilizing, and then there's like an 18-month taper, right? And so the plan was that nobody should stay on Suboxone for more than 2 years, and that was how he engineered this drug, right? The problem is that you don't have to be educated on the model to sell the drug, right? And so now you can go to like the average Suboxone clinic, you can go to the average methadone clinic. These doctors, first of all, like you're a methadone patient, right? Previous methadone patient. How much time do you spend in front of the doctor monthly?
5 minutes.
5 minutes. Who are you mostly interacting with?
The nurse at the window and other patients.
Yes.
And that's one of the things that was always stressful for me about
Yeah.
those places. And it's the whole place feels like the worst NA room that you've ever
For sure.
been in.
For sure.
And you're staring at every mistake you've ever made, standing around you.
Yeah.
And it's definitely a mirror. It's definitely a mirror, and I think it's good for a little bit, but after a while, you're ready to go. You know,
Yeah.
I'm ready to go. And that was how I treated my methadone this time around. The first time I was on methadone for almost 5 years, and I stayed on for almost 2 years before I started tapering. I had a long taper with that one. And then this time I was on methadone for almost 3 years with a 2-year taper, and I started dropping as soon as I hit a year. I think maybe even a little sooner. And even the nurses were like, "What are you doing, honey?" And I was like, "What do you mean?" They're like, "I think you might be dropping a little fast." And I wasn't even dropping fast, Matt. I'm talking like when I was at, this past time I got up to 130 milligrams. So I started dropping at 5 milligram increments first.
Like every other week?
Yeah, I mean, I drove my taper the whole time. I had this long conversation with my doctor where I was like, "Look, I need you to let me tell them when I want to go down and how many milligrams I want to go down," which is something that I wasn't able to do at the first clinic I was at, and it was maddening. So this doctor listened to me, and that's what they did. So, but I would go up to the window and let the nurses, because I had take homes, so I would have to tell them how I wanted to draw out my taper for the next few weeks, and they would sort of try to tell me that this was not suggested. And I ended up having a conversation with my counselor and the doctor saying, I understand you guys are well-meaning, but it really messes me up when you guys do that, because I feel confident in what I'm doing. And when you tell me that I may not be successful, it makes me wonder if I'm, on a pink cloud or whatever you want to call it, that I think I've got this, but this is more like a slow death or something. And I don't want to think that. I don't want to think that I'm destined to have to go back to the clinic at some point. And look, I know a lot of people that actually end up back at the clinic before they've even relapsed on opiates. Will they do that here? In North Carolina, you don't even, as long as you've been at the clinic within a certain amount of time, you can go back and you don't have to test positive for opiates. You can just say, "I'm going to relapse. Like, this is so bad."
I don't know if they do that everywhere. I know that they do that in some counties in California. The biggest problem with MAT is that they forget the T.
Yeah.
Right? And the problem with forgetting the T is you're now... So, first of all,
This is a great direction to go.
Yeah. I am not anti-MAT. I was on MAT, and it was a nightmare, but it also maybe saved my life, but it also I almost relapsed over it, right? Like, because of whatever. The problem with MAT, as I see it today, is that nobody does the therapy, nobody does the treatment, right? There's this one place over here, it's called Symmetria. It is actually an IOP that offers MAT, right? So in order for you to be on MAT in this program, you have to be in an outpatient program, right?
That's a good idea, I think.
I mean, I think it's a great idea, because now, so pre-85 field of recovery, they used to say length of exposure to treatment episodes dictates outcomes. So the longer you participate in this, the greater the chances of a better outcome. 28-day model gets normalized, standardized basically, and they drop 2 words, and it sounds very similar. Used to be length of exposure to treatment dictates outcomes. Now it's exposure to treatment dictates outcomes. In a day and age where 28 days is the average. right? And so what they used to tell you was your outcomes will greatly increase the longer you are in treatment. So this is when, 20 years ago, I have a friend, his dad went to treatment in like 86. I think it was 86. In order for his dad to stay in treatment, his kids and wife, or his family had to go to the treatment center for a week, right? They would have kicked him out if the whole family didn't um, commit to going to their family programming for a week, right? And then he stayed in for however long he stayed in there, and he stayed sober, right, for 30 something, but before he passed away, right? Like, and so what you're looking at here is like, first of all, the this is so crazy, but the insurance agencies have like a legal fiduciary obligation to maximize profits, right? Like if they don't maximize profits, like they can get sued, people can like get in trouble, lose jobs, all that stuff, right? So their job is to make as much money as possible. United Healthcare is notorious for this. People have like pretty definitive proof that they do this, but I'm almost positive all insurance companies do this. But United Healthcare at the end of the fiscal year will do all of their analysis, and they will, based on last year's cost, like overhead, they will decide like, is next year going to be more profitable if we pay for the claims or if we take the because if they don't approve stuff or whatever, they get fined, right? Like they get penalized for not approving claims. So they will say, are we going to lose money by approving the claims, or are we going to save money by paying the fines?
So who's in charge of figuring out the network stuff? Because what I think, unfortunately, really would be helpful is there need to be more psychologists like in the industry as well.
Treatment industry?
Yeah, I think that that a lot of the psychologists that you go to see that specialize in stuff like that don't take insurance. It's private pay.
Yeah.
And I think that deters a lot of people from getting that kind of treatment. And like you said, I don't know how it was with your Suboxone doctor, but at a methadone clinic, you're not getting treatment. You're not getting therapy. You have a counselor that you have to see. They say you're supposed to see them for 20 minutes once every 2 weeks, but that gets it into 15 minutes once every 2 months. And then it's like a different counselor every other time because the counselors keep leaving. And so you don't even get the opportunity to build up a relationship.
Yeah. So again, and this is not to criticize psychiatry, psychology, or just psych in general, but I personally, this is what I think, is that it's almost fucking pointless to like go do like that kind of therapy if you don't have like the foundation of recovery already like set, right? So most people, it's like they go to treatment, they get out, they start seeing a therapist or whatever, and they relapse. And a lot of the reason why is because you cannot talk your way out of or think your way out of a situation that you acted your way into. It doesn't even make logical sense, right? Like you have to act your way out of it. And then dealing with underlying issues, a big thing right now is EMDR, right? You know what this is?
I know what it is. I've never done it.
Yeah. So EMDR, there's anecdotal and like data that says that it's super effective, right? But there's also a lot of conflicting data that says that it's ineffective, right? And what we are finding is that it is effective for specific people because of what they have done previous to the therapy, right? And so it's like, in order for this to be effective, in order for you to in real time relive these traumatic events, you have to have a foundation of like coping skills, recovery, like community, like all of these things in place in order for this to make sense, right? And it's like people are going through EMDR, they're going to treatment for 28 days, and they're doing EMDR in treatment, not making commitments to lower levels of care, and they're going back out there re-traumatized
I was going to
recently.
say that doing EMDR really early in therapy sounds like it could be more traumatizing,
Very
especially if you
traumatizing.
don't have follow up.
For sure. So Dr. Shaw openly talks about this. He did EMDR 5 years into his recovery, and he did one session and had a full blown vision, like visually, like immersed into this memory that he had forgotten for 30 something years of
Wow.
his sexual abuse. Right? Can you imagine that? Like two weeks after you
No.
quit using, right? So
No.
it's like, so a lot of what people, and it isn't an intention thing, right? The intention typically is good, right? They have good intentions. The problem is that uh, we think that because it worked for A, that it should work for B, right? And we're going to blanket this stuff because it's like the statistics are out, basically. It's like if X amount of people are not going to get clean and this very small component of the milieu is going to get clean, and this is going to help that person, then let's just do it for everybody because they're going to relapse anyway, right? So it's like they're making like mathematical calculations on what it is that they're going to do based on like this very small statistic of people that it's going to work for.
Okay, so I see why maybe there don't need to be more and psychiatrists in treatment.
There needs to be no psychiatrists.
There don't need to be any psychiatrists. I find it interesting everything you just said because the therapist I've been with has sort of we've been so it's my belief that, or it has been my belief that one of the reasons I relapsed was because I had some trauma that I hadn't dealt with. And it's not that I was hiding it or didn't want to talk about, or didn't want to share it. It's just that it's so heavy that I never know how to talk about it.
Mm-hmm.
Like, I'll just talk about it on here. So I've had 6 abortions.
Okay.
And that's over the course of 25 years, I guess, starting as a teenager. And I felt, I will say this for myself, I really felt like I didn't have a choice for any of those abortions. I was using for the majority of them. That said, the older I got, it started to really affect me.
Mm-hmm.
And I became aware that this was something that I wasn't bringing up because I was really ashamed
Mm-hmm.
of it. Like, very ashamed.
Okay.
And so I have brought some of these issues up in therapy, being like, well, should we talk about this? You know? And she always says, if you want to talk about it, we'll just talk about it. But it's like a tea kettle that has to let, you don't just let it all out. It doesn't come blasting out all at once. It sort of,
Right. There's like a pressure gauge.
Yes, there's a pressure gauge and you have to sort of keep track of it yourself. And when you're ready, it'll come out, but don't force it.
Mm-hmm.
And I think sometimes if there's too much raw emotion around it still, it may not be beneficial necessarily.
For sure.
And there's other things that you can focus on, like you said, building that foundation and the confidence and the strength of knowing that when it is time, it'll still be there to talk about.
Mm-hmm.
And in the meantime, it doesn't have to eat me up inside.
Yeah, so shame and guilt are an interesting thing when it's attached to trauma specifically, right? Because a lot of the shame and guilt that people have around their trauma is inherited because of stigma, right? Where it's like sexual trauma, right? I was sexually abused as a kid, and a lot of why I didn't want to talk about it was because of what I thought other people would think, right? Ultimately, like, through the process of dealing with it, because it's always a question, right? Am I using over my trauma? And once everything was said and done, for me at least, working with a really good therapist that I was able to really, I mean, just really talk about this stuff with him, right? And it was a female, and she goes, "Look, like once all was said and done, 18 months into this," and she was like, "Look, you're not using over your sexual trauma, right?" And I was like, like it was such a relief, right? Because I had the same question. Is like I had 3.5 years of sobriety, relapsed, and the question in my head, because I had never admitted it to another person, and I was 34, right? 34. Um, my question was like, is this gonna be also because like I was done using,
Right.
right? I was like at that point in my life because of the decisions that I had made about using. Like when I left my family, my decision was I'm gonna go do this until I'm done, and I'm not gonna come back a minute before that, right? And if I die while I'm out there, I die. And if I end up in prison for life, I end up in prison for life. And if I make it out, good, right? So I made it out, and then 3.5 years later, I relapsed, and I was so confident that like I wasn't going to use, right? I was just so confident. So then the question was like, am I using over my trauma?
Right.
So then I go and address the trauma, and all of that really helped me understand that it was like I like fundamentally I use because I like to use drugs. Like there is no other reason, right? And I can try to point to like this or that or like whatever, some outside circumstance that I have no control over to justify why I used. But if I can do that, then there's a good chance that I'll use again in the future,
Yeah.
right? So I had to take responsibility for even being sexually abused as a kid to be able to be like, I don't care what power somebody had over that situation. I now have the power to not use over it
Right.
because they don't control whatever the outcome is anymore.
You don't have to use it as an excuse.
I don't get to
Yeah.
either, right? Like a lot of people, I feel like, so for people in recovery who don't deal with their trauma, it's like that ace card that they have up their sleeve to be able to point to it and be like, this is why I can't get clean.
I think you might be right.
Yeah. And so it's a choice. I think that long-term recovery is a choice, and also long-term effects of trauma is also a choice. Like after a certain point, it is now a lot of a big problem with it is people adopt it into their identity too.
Mm-hmm.
Right? And so now it's like you've got this identity built up around these circumstances, right? And it's like you can point to like this is an easy one, and I'm not saying that this is just across the board what happens, but like you can point to like the 13-year-old gothic girl that like cuts herself and is like suicidal, and point to like the underlying trauma to be like, that's why this person is like this, right? Like it's correlated, right? But after that 13-year-old becomes a 35-year-old, becomes a 45-year-old, and they're like still dealing with the same thing, that's a choice.
I agree. It's like we have these sort of, for lack of a better term, big T traumas that
Sure.
happen in our early life, and they kind of shape who we are, our choices, our decisions, and our behaviors. But then, as a result of our choices, decisions, and behaviors, we end up with a bunch of little T traumas, and that's usually what ended up sending me back out was like all of the little stuff that I just couldn't manage from day to day,
Yeah.
little stressors and things like that.
So I am thoroughly convinced that like
My abortions weren't sending me back out there.
For sure.
Yeah.
Right? That there are downstream effects of our choices, right? And from what I've seen, like, and I'm not like, I haven't worked with the most amount of people in the world, right? But I've done a lot of time in prison. I've done a lot of time in treatment, and I work with a lot of people in early recovery. And one of the things that kind of stands out to me is that most people end up staying sick because of codependency, right? And enabling, right? Where it's like you have that family member or that friend group that will just completely enable you, and like the codependency is there. And now you're not using because of whatever happened. You're using because of the pattern around the codependency and the enabling.
Yeah, or like a big one I think is families that won't allow their children to experience consequences.
Oh, dude, it's so detrimental.
Yeah. I had that early in my treatment. I'm very close with my dad, and I'm still going through this weird process of gaining autonomy from him, because there's a lot of different reasons that we ended up so close. One, I'm an only child. Two, we were both traumatized by my mother's addiction and alcoholism. They were married for 22 years. So we sort of became codependent even when I was like a little girl. We were, he was coming into my bedroom to comfort me from my nightmares. If I would go wake my mom, I had all of these terrible nightmares as a child, and if I would wake my mom up, I would get in so much trouble. So I learned to like sneak in there, just wake my dad up, and then he would come back to my room with me. And so there were just these things where we sort of became like best buds very early on, and then we both experienced a lot of trauma. And as a result, I think he developed this complex of just, he sort of felt responsible, I guess, for some of the stuff that happened in my...
Let me stop you really quick so that I can say something and then you can continue. I tell parents all the time that when you take responsibility for somebody, you've taken responsibility from them, and you are now effectively a contributing factor to their slow death.
That's a great way to put it. It's a great way to put it. And that's how I felt, because when you have, unfortunately, somebody that's close to you that you're meant as part of your life's journey to gain autonomy from, and they are literally providing you with everything, whether you want that or not. And I think when we're actively using, we don't see how harmful it is. But like when I got...
Well, no, we only see the benefit of it.
Right.
Right?
Right. But now I see things where, I'll tell my dad, hey, I'm going to do that. Like at the end of the year, I'm going on a almost 6-week trip to China, Tibet, Nepal, and India. And he just lost it when I told him that I was doing that, and immediately started in with all of the
safety concerns.
Yeah, and that, I won't, if anything goes wrong, I won't be able to come. And I said, you've got to just chill. And we've been having this conversation for years at this point, so I'm not even sure if he can. He's not in therapy. He went to like a codependency program once 20 years ago at a rehab. And so he knows all of this stuff in his head, but he hasn't moved it into his heart. And I'm just constantly telling him, like, you got to let me experience discomfort. And also I can handle it,
There is like an instinctual genetic, like baked into his DNA to protect you.
Yeah.
There is parts of codependency that are like naturally occurring that also, because of the color that codependency is painted as, like it is only seen as a negative thing, right? One thing that I like to that I'm starting to like challenge more is that like there is healthy and like unhealthy and healthy codependency. Right. And then is the healthy codependency even codependency, or is it just like relational? Right.
Is it just love?
Right. But what is the threshold breaker? How do you actually delineate between the two? And that is the hard part for parents, especially like as a father with daughters. Like, I don't know. Like I tell people all the time, I couldn't take my own medicine around my kids. I could tell everybody in the world, like, you're killing your kid, you're doing this, you're doing that. But if my daughter was out there doing what I was doing, I would be out there trying to rescue her.
Yeah.
It's like, I don't know if I could take my own medicine around the prescription for what, like, helping somebody in addiction actually looks like.
It's crazy you say that, because one of the reasons my father stopped going to therapy, he did the codependency program, and then they told him you need to get a therapist, and he went to therapy back where he lived for, I don't know, maybe a few months, and then he stopped. And I think that for him, it is just very much. I think what you have to do as a parent is constantly be willing to check in with your children, because if about sure, if they're out there using heroin, that's a different story. You're going to be really concerned. But if you're just trying to guide them, like we'll use my trip to India as an example. Then if I call you as my parent and say, I'm going to do this. I'm a little anxious about it, but that's okay. I kind of feel like it's your job not to tell me all the reasons I should be anxious about it. But unless I'm literally about to go do something that's just really detrimental, then I feel like maybe it's the parent's job to say, you know what, you got this, and that's what I need. I need people to be a cheerleader. That's, kind of what I never had. And because I can shut myself down really easily if I have other people telling me that
it's a bad idea.
It's a bad idea because I don't fully trust myself as an addict in recovery yet. Do you think there's ever a time when we can fully trust ourselves, or do you think that we will always sort of be wondering if we're making the right choices or not?
Do you know what Sam says?
No.
Okay, I'm gonna.
Oh, Sam said, the
substance abuse and mental health. Okay. So this is their working definition of recovery. Recovery is a process of change through which individuals improve their health and wellness, live a self-directed life, and strive to reach their full potential. And self-directed life comes before striving to reach their full potential.
Yeah.
Okay. So, are you a 12-step person?
Not anymore.
Okay. So, I think a lot of the reasoning... Okay, let me say this first. I'm not anti 12-step. Everybody that I work with in a coaching capacity, I tell them that my ultimate goal is to get them to work the steps.
I believe in step work. I just
sure.
don't think it has to be done in the rooms.
Well, yeah. So, the problem that I'm seeing, this is such a long conversation, but the treatment industry hijacked the 12-step model, okay? So now they've attached consequences to something that was supposed to be
they compel people to go.
Yeah, and then they've attached consequences to something that's supposed to be voluntary, and they did it for terrible reasons, right? They were trying to adopt somebody else's goodwill and somebody else's reputation into what they're doing. Okay, so now let's look at the language of the 12-step model. Programming, right? Like, in and of itself, right? When you actually look at, like, who else programs, right?
The government.
The government, prison systems.
Yeah.
Cults, like.
Oh yeah, cults.
Yeah.
I know a little bit about that too. I think we talked about that before I came.
Yeah.
We have to be careful about that. We have to be careful in recovery to not get reprogrammed into something else. I think we look for magical, so like we're prone to that. We're prone to thinking that we're going to find any solution to escape how we're feeling that isn't actually just serious introspection and practice through learning.
Well, and then what else happens is, let's say you're sponsoring somebody, right? And you're telling them this is exactly how you have to do it because this is how you did it. Are you doing this because of the outcomes for the person, or are you doing this to solidify your path, like in your own mind, right? I think that what's actually going on is most people are actually trying to justify their own path. Because most of the time, forcing somebody to do it how you did it does not work, right? And so it'll be like you can sponsor 20 people and 2 of them will stay clean, and you will base what you do off of those 2 people instead of changing it because of the other 18, right? It's like, so programmed to provide with coded instruction for automatic performance of task. Right? What and it
Wow.
they teach you, do not question this. Just do, don't ask, right? It's
Yeah.
like, just do this. Right? Just come back no matter what. Just don't drink no matter what. Just do the 4-step. Just do this. And then it's like in the treatment industry, in treatment facilities, they've got all these weird criteria and like all of these weird things that they do around step work, where it's like, in order for you to go to step 4, you have to do these 10 pages of this, and you got to have at least 20 people on your 4th step, and you got to do this and you got to do that. And it's like, nowhere in the book does it say any of that.
And what else is bad for recovery is probably people feeling like they're being forced to do something.
Dude, it's, you made something.
It creates resentment, and what do you do with that? You use.
Yeah, I mean, yeah. Any reason is a good reason, whether it's good or bad, right? Like, but when you take away the option to participate in this thing, you are pushing the majority of people out the door.
And look, we can even move this back to the family members, because I'm thinking about my dad still in this codependency program. I'll give you 2 examples. We did a codependency week in my early 20s at this place I went to in Florida for basically almost a year, and I didn't stay clean after that. But well, I'm not going to blame it on anything. I didn't stay clean, but
Hold on. That is a problem too, right? Because we are being sent people's children, and we are promising them, like, the promise up front is if you send them here, they'll get better.
Oh, especially if they spend enough money. Those $60,000 rehabs need to be more clear. It's almost like the more expensive it costs, they go, we got this.
Yeah.
We got this. That you don't see the $60,000 rehab centers telling people, oh, they're going to have to come back 7 times.
Yeah. No, an average of 7 times. Sometimes, anyway, when that client ultimately relapses, we blame them.
Yeah.
And this is where my question around
So
value-based.
then we blame ourselves.
So now, again, we are inheriting guilt and shame that wasn't ours to begin with. We are being sent into a situation where they are feeding us hope and then not reflecting what they're promising with the type of programming that they're doing.
Yeah.
Right? When you look at, like, the beginning of AA, right? How did we go from, like, a situation where basically everybody that interacted with a program got sober? Now 100 years later, basically 100, like, coming up on 100 years, right? 29 is, like, when they started doing this thing. Basically 100 years later, with billions of dollars in research, billions of dollars in scientific advances, social advances in awareness and acceptance, like, all of these things that should actually point us in the direction of, like, getting better, that we have completely flipped the script, and we're basically almost nobody gets sober their first time around.
Yeah.
How is that even a thing? I'll tell you. There is no money in healing.
Yeah, you're right.
This is across the board.
There's never been money in healing.
No. You want return customers.
Yeah.
The average treatment center is paying their bills with their return customers, right? This is like their baseline monetary need is, if they've got a 50-bed facility, a good chunk of them are coming back for the second and third time.
Right.
Right? So it's like, take the second and third timers away, and you are struggling to pay your bills.
Wow. Yeah. I didn't think about that, but it's true. I think that I'm going to go circle back to the codependency thing a little bit again. Sorry. But the programs that push the codependency programs and the treatment, the long-term treatment stays, they are pretty aggressive, not just with the patients, but with the family. And I think sometimes they can be too aggressive with the family. And I've seen that in a couple of ways. One, when I was there, they actually had this big group where there was, I'm not going to tell his name because of anonymity, but there was one kid there who had a really big inheritance that he was going to be getting. And the counseling team like went at him and this family and the thing and this group and was like, you've got to remove him from your will. You need to write him off, all this and that. And we spent multiple groups arguing about this. And then finally, the last day of this program, they came in there with a document they had their lawyer fax over and literally made this a spectacle in front of the whole group, signing him out of the will. And guess where he was a week later? Under a bridge, he's dead now. And they said he'd be dead if that didn't happen.
Yeah.
So, and then my father is also a good example of somebody that tried to do the right thing and continued going to Al-Anon after he left, but he became almost shocked at the level of just callousness that he found there. People saying, "Oh, my adult son, called me a few times yesterday and then showed up at my door last night at midnight when it was raining outside. And I looked out there and saw it was him. And I didn't open the door, went back upstairs, went to bed, and I slept great." And my father would tell you that his jaw just hit the floor. And he was like, well, I wouldn't be able to sleep if I did do that. So this is just another example of how it looks different for everyone. And I think that forcing it can actually push people out, because my father does still need a codependency program, but he'll never go back. He'll never go back.
So this is where the water gets murky around codependency, because they try to blanket statement a lot of things, right? When it's so subjective. Like, every individual addiction is so different, and everybody's recovery is so different. And I do tell families, right, like, that you are like, there is objective truth to the contribution of the codependency, right? Like, there is obviously markers that we can use to define and delineate what's helping and hurting, right? And I use that example specifically. You never know if you letting them come in that one time just robbed them of the experience that would help them to come in forever, right? But this is all subjective, right? Like, and it's unfortunately, like, this is a raw truth about it too, is that a lot of it is gender specific too. You can't treat a boy the same way that you would treat a girl, right? It just it doesn't compute, right? There are dangers that are specific to women that are not even a thing for a lot of men.
Like what?
So I will say this. I have a guest that just came on that was, as a man, sexually assaulted. Okay? So I'm not saying that it is gender specific and it is across the board monolithically true. These are things that are not monolithically true. But there are like presuppositions that go into these thought patterns of mine that would say that, like, there is a gender specific problem to sexual assault. Okay? I'm not saying that men can't be. I was sexually abused as a kid, right? By a man.
Are you saying that men and women have a different response?
Men and women have a different. They are subjected to different vulnerabilities.
Okay.
Based on their gender. Okay, so, like, the way that I would deal with a son is massively different than I would deal with a daughter. And in those situations, discernment has to be used, but also there's, like, calculations that have to be made on experience too, right? So, like, if this has been 20 years and it's like a 35-year-old adult son is calling because it's raining, you're going to have to sit in the rain, right? But if it's like my 18, 19-year-old daughter who's calling because it's raining and she needs somewhere to sleep, she's probably coming in. But if that same daughter 20 years later is doing the same thing, it's like, dude, go figure it out.
Yeah.
Right?
Yeah.
And so there's components to the decisions that have to be made, right? And there's calculations based on experience and based on costs and benefits, right? It's like, is it really going to hurt this person to be out in the rain tonight? Probably not, right? But in their experience, like, based on their experience, like, are you going to let them in or not? Those are the kinds of, and so the reason why the water gets murky is because outside people trying to dictate what's going on within a family dynamic doesn't make sense. You can make prescriptions based on the overall overarching theme, but it still might not apply.
So this explains why I've seen a lot of families leave treatment with more trauma.
Oh yeah.
I mean, it's sad.
For first time, so especially for parents of like older people, like the 70-year-old parents that are dealing with the 50-year-old addict, um, those people that have been dealing with this for 40 plus years, it's almost pointless to try to tell them how to deal with it. It's really almost pointless.
Maybe nobody knows better than them.
And at that point, that's true too.
And also they're just set in their way.
Yeah, but also it's like, um, if outcomes are what we're actually looking at, this person is so dependent, right, that it's like this could cost a life.
So how do you feel about, I imagine that you have complex feelings just as I do, but how do you feel about harm reduction as a model?
I don't have complex feelings about this at all.
Okay.
What I think is that it's been miscategorized, right? I think that harm reduction is being miscategorized colloquially because people think of harm reduction and think of needle exchange.
Yeah.
Right? That is not harm reduction in a practical sense. That's harm reduction in a political sense.
Right.
Okay, so harm reduction from a peer support lens would say that there's a harm reduction plan in place to help you stop exposing yourself to harm. That's true harm reduction, right? And so in order to go in the rooms, right, there's only one requirement for membership, but there's a requirement for participation. That's abstinence, right? The requirement for membership is a desire. The requirement for participation is that you are no longer under the influence.
Right.
Okay. I was living under a bridge, putting needles in my body multiple times a day because I had no veins left. I was muscling everything, meth and heroin. How are you going to tell me that in order for me to get clean, I have to stop? In order for me to like go into this room for the solution, I have to stop doing all this first.
You can't. And I've heard you talk a little bit about this on here in other terms too. And I'm also sort of in the category of everybody's recovery looks different. I don't think that giving everybody, I think it works for some people that have had the right consequences, but I think for others that have had other consequences and whose story looks different, having a real hard line stance drawn about what deems whether they're in recovery or not is detrimental. Because if you're like well, we'll use medication-assisted treatment, for example, but maybe THC is another example. If you're somebody that's been banging heroin for 12 years, I feel like, and this is why I stopped going to the rooms, and I'm by no means the first person to say this. Hundreds of millions of people have said this. I didn't feel like I wanted to continue to be present at a place that was telling me that I wasn't sober, that I shouldn't be speaking, that I didn't have anything to contribute, when to me, I felt, what? This is the most sober I've ever been in my life. This is sober for me, right? And especially if you're somebody that's not actually getting high off, because we have to be clear that there is a difference between somebody that is, going to a clinic and is constantly escalating their dose beyond their maintenance dose, somebody that's going on 200 milligrams, 230 milligrams, and they are, I'll use the word high on the substance. I mean, it definitely affects them. And I think that there could be a better distinction made for this person is actually using this medication as intended, and they're definitely in recovery. And they have something to contribute. How about that? And we should allow them. This is the person we should maybe be allowing to share, because they're potentially in early recovery, and they're potentially ashamed.
So there is, again, multiple things going on, right? First of all, is that as an organization, they can handle things however they want.
And every meeting and group meeting leader is different.
Right? And so if we just go down to the baseline of just the 12-step program, AA, NA, CA, CMA, HA, whatever, they've got traditions. And as the individual, right, this is partially why I quit, right, is as the individual, out of respect for their traditions, I shouldn't try to change them for what I want or need, right? So there's that. But then also, what really, really is funny to me, look at this. So according to notes from his nurse, right, who was also an early Alcoholics Anonymous founder, Bill Wilson repeatedly asked for whiskey on his deathbed while dying from emphysema in the late 70s.
Wow.
Okay, so there's that. Also, Bill Wilson.
I knew about that.
Yeah.
And I think and I have my own opinions on this, and I'll talk about it on here, because last time in sobriety, I used ketamine as part of how I got off meth. After I got off methadone, I had a lot of issues with, I guess, just my neurotransmitters and receptors recovering, as I have this time. Then I decided that doing ketamine was
clinically
appropriate. I also heavily leaned on THC during that methadone taper, not this one, but the last one.
Mm-hmm.
And I thought that I think that it had its place, in that it was allowing me to get off this medication. But I did see that after some time, I felt like I needed that then, like I started to depend on it. And with the ketamine, it was that I found that just doing it, a couple of times a week wasn't enough. That then whenever something bad would happen in my life, I was like, oh, I need to go do a ketamine treatment. And I mean, in some respects, that's kind of how they have it set up. But I think that so I'm a proponent, obviously, of psychedelic use in recovery. But I think that it needs to be controlled in a way that it's not. And like this kind of circles back to the magical thinking. Like, I've never done ayahuasca, but a lot of people in recovery talk about going and doing ayahuasca, but then they don't just do it the one time. Like, they keep going back and doing it, once a year. And I don't know. I don't know that psychedelics, while they are really powerful, and I understand some of the neurobiology around it, I'm not sure that long term, like using a psychedelic chronically long term, doesn't just do the opposite, because it keeps you in this state of not processing almost.
Yeah. So I look, in and of itself, LSD is neutral. In and of itself, psilocybin, neutral, right? And just like everything else, language, gum, anything.
Yeah.
These are technologies. So when we look at tools, right? They like a hammer, right? I always use this one. You can build a house with a hammer, or you can beat somebody's head in with it. The hammer didn't do it, right? You did. And so it's up to the operator to dictate the outcome. And so if you are using a tool inappropriately, it's probably not going to have the best results.
Right.
If you're using it appropriately, it might help you, and it still could not, right? It's like, but this is where having the ability to discern between something that's helping and hurting is massively important. And so, like, I think that psychedelics are going to revolutionize the way that people recover. But I also think that this is not something that you should do in your first
lightly.
3 weeks, 6 months, maybe even a year of your recovery, right? Like, again, this is like, without the foundational pieces of recovery, almost nothing is going to work.
Yeah.
Long term, at least.
Yeah. And we've seen it again and again.
Probably millions and millions and millions of like case studies can be done on people ineffectively using tools that ultimately led them down a path of destruction where the tool was actually meant to help them, but they didn't use it appropriately.
Right. So for me with the ketamine, I started using it because I was trying to get over the methadone bumps, but it very quickly became about other parts of my life that I hadn't processed. At that time, I was in a toxic relationship, and that didn't change. Like the dynamic there didn't change. And so the ketamine was just another escape. And at a certain point, it was, well, this is no different than, I mean, maybe it's less harmful. I'm not sticking a needle in my arm and it's a prescription, but it's the same reinforcement.
Look, you can, my brother's not an addict, okay? And he's always calling me like, hey, what do you think about this? Or what is that? Like, tell me about like this, you know? And it's like, so he told me what he got back on his Adderall, right? And he called a doctor and was like, hey, I'm trying to get back on my Adderall, da da da. They were like, the soonest appointment is 6 weeks. He was like, what? He got online, and within 2 hours, he had the prescription in his hand, right?
Wow.
Yeah. And so anybody who has just a little bit of willpower to like get on these prescription drugs can do it like that with almost no justification. And if you're going on to like an online source, you don't have to expose any of your addiction history. And now you're like, if you're a meth addict, you can go get on this Adderall with no exposure of your past to this doctor. I mean, within a couple hours, you're high, right? And sometimes after long-term sobriety or even like a year of sobriety, it's going to take you a few hours to go find the drug anyway. So you can get online and find these drugs even faster.
Yeah.
Right? Now, being able to, it's a matter of do you have the tools or not, right? But it's like being able to pick up the tools that you've have in your bag, right? And use them, and discernment, right? Coping skills, decision-making processes, all these things are tools, right? And it's like, if you don't have those things in place, that sounds like a really good idea. Like, once relapse or using becomes an option, like, if I was going to relapse, I would try to find the most legal way to do it. Like, at this point in my life, I'd be like trying to get on prescriptions, right? And you can do it all day, very easily. But it is effectively the same thing as going out and picking up drugs on the street.
Yeah, I've experienced this with some friends of mine that got clean, and then, well, one in particular that started using marijuana heavily, and it was all in the guys. Well, I think maybe it was helpful at first, but it became such an issue that it became its own issue.
For sure.
You know, and then there were other consequences. So this sort of goes back to the magical thinking, like us thinking that there's any solution other than just going through the work. It's like they talk about you can't hop over the door or even go around it. Like you have to go through it. You have to go through it. And a lot of these things that we lean on are just kind of a way to try and just skirt around the door.
Yeah, I mean, what has become normalized is lessening consequences and treating symptoms. Like we aren't actually treating the underlying issue, right? What we're trying to do is outwardly see less symptoms, right? And then as a client, ultimately what we're trying to do is not manifest symptoms like as much as possible so that on the outside everybody thinks we're okay. Because doing whatever needs to get done fucking hurts. It's uncomfortable. It's work. It's not easy, right? It also takes time. It's way less satisfying than getting high or, a lot of destructive, there's like a lot of destructive behaviors that are acceptable in recovery, right? Like destructive sex, destructive work patterns, destructive, like a lot of things, right? A lot of people, something that I'm starting to realize is that most people who enter recovery also need a sex and love addiction program.
I can believe that. I think that most addicts are addicted to love, if not all, because love is a great drug.
Oh yeah.
I mean, it's one of the best drugs. And that's, that's what part of toxic relationships are, is that, the up and down, the, what's it called? Trauma bonding,
Oh
sort of, where
yeah.
you have this negative experience and then you experience so much pleasure around the mending of whatever that was.
Mm-hmm.
And that is like a super toxic cycle for most addicts.
Mm-hmm.
This is why I've been single for 2 years. I've been intentionally single for 2 years, and it's been hard. I'm surprised. Maybe it's not surprising at how people don't like that. Like, everyone's like, really? Why? What? Men and women don't get it. But dude,
You know why though? You know why? You know why they act like incredulous around it? Because they could never do it,
yeah,
even though they know they should.
yeah. Well, I have seen the holes that relationships have got me in every time,
Mm-hmm.
because I'm also a huge people pleaser. Like,
Mm-hmm.
that's my thing. And so I will just, historically, I will let someone run me into the ground before I will ever speak up for myself
Mm-hmm.
and draw any kind of line in the sand. So, yeah, no sex, because sex leads me to that immediately.
Mm-hmm.
And we talk about not addressing all of the big T traumas in therapy first. This is the kind of stuff that I've been talking about in therapy
Mm-hmm.
for the past year. Is I need to stay single, and I need to make sure that I'm going to stay single. How do I, swat off this fly and that
Mm-hmm.
fly and just keep in my lane?
Well, okay, so homeostasis, right? Returning to homeostasis after extreme or long, like prolonged, or even maybe not extreme and prolonged, just use in general. Like, we were all born single too, right?
Yeah.
And it's like redeveloping the relationship with the self is part of the foundational piece of recovery, right? And that's why they always tell you you shouldn't be in a relationship for the first year, even though like a lot of that reasoning that they give is nonsensical. Like, most of it is just dogmatic, right? There's actually a really good
They
reason why.
don't really do a good job of explaining why.
No, no. Well, I mean, the reason why I say it's dogmatic is because the average person doesn't understand why either, right? They just know that they were told that, and so they're going to tell the next person that, and that person's going to tell the next person that, and that there is no reasoning. It's all nonsensical. Like, they just
Yeah.
do it because they were told.
I feel like, at least me, I was sort of told that the reason to stay out of relationships for the first year is because I just needed to focus on myself.
Sure.
That I had plenty to do in that year. But what I didn't get, and what I actually needed to hear, as proven by later mistakes I made, is that no, being in these relationships this early is way too overwhelming. Like, if you're not clear on your boundaries or who you are or what you want, it is going to run you over in a heartbeat.
There is nothing better at derailing a good recovery like a fucked up relationship.
Yeah.
Like, nothing will destroy, like, using doesn't destroy like a recovery episode faster or better than more completely than a bad relationship will. Because I know plenty of people that have like done the like one night relapse, got back on the horse, and like been fine. You get into these destructive relationships and it will literally deteriorate you as a person.
Yeah, it will. It definitely will. We said, you end up back in that cycle of not feeling good enough, and you don't know where else to go to feel better except this same place that's making you feel terrible. And it's very toxic. I think that people also don't want to hear about staying single because they don't get it. I think that there is a large majority of people that have never stayed intentionally single for a long time, and so I guess it's some kind of enigma.
I mean, it's foreign for sure. There's also, there's something very rewarding to, at least from a man's experience, right? There's something very rewarding to somebody else's acceptance. right? Like almost unconditional, like especially in these toxic relationships. Like I know people that like you can beat her, cheat on her, steal from her, and she will stay.
That's it. I don't want anybody to love me unconditionally anymore. Like I've had that and it was toxic.
Yeah.
I've not historically dated addicts. I've only had 2 relationships where the addiction was part of the relationship. So when I entered into a relationship with these other people who weren't in addiction, I thought they were way healthier by comparison.
Yeah. Oh, dude, I tell everybody like that are not married in recovery, do not date people in recovery. It's like the worst fucking idea that you can do. I have a Dr. Shaw. I tell him all the time, stop trying to date people in recovery. Like you, it's just yeah, it's a very bad idea.
Yeah. I think that just dating an early recovery period is a bad idea. But 2 people dating, I don't know. I don't know what's more toxic because there's obviously something that can be toxic about getting clean and then getting into a relationship with another addict who's also going through the same stuff. But there's
Yeah.
also something toxic about getting involved with people that won't keep you accountable in ways that you need them to keep you accountable because they're unfamiliar with any of it.
So, do you know why they say that long-term recovery happens at 5 years?
No.
You are statistically as likely to return to addiction as a person who's never been addicted.
Okay, well, that makes sense. I've heard that about felony convictions. Like, if I'm a felon, if you don't recommit in 5 years, your chances of recommitting go down by over 90%, which is why some places, some states will reinstate gun rights for hunting and stuff
Texas.
after a certain period of time has passed.
Texas is 5 years.
Okay, that's pretty cool.
I don't know the reason around the criminality thing. I haven't I'm a dude. When you look at my rap sheet, I look like I'm a 60-year-old convict. Dude, it's like first prison term at 18, last arrest was for like bank robbery and like residential burglary, selling drugs to cops, weapons, just all kinds of shit, right? I don't know why around criminality that is true, but I know for sure that there was like extensive studies done by the Air Force. It's expensive to train fighter pilots, and a high percentage of them are drink alcoholically, and so they've done like massive studies specifically on fighter pilots around like what long-term recovery is and why. And so yeah, that was the statistic that they came up with after all was said and done, was that you are 95% likely to stay sober for the rest of your life, just like somebody who's never been
So there
addicted.
has to be neurobiology around that.
Oh, there
have you
is.
talked to Dr. Shaw about it?
yeah.
I mean, maybe there's just changes that take place
Oh, yeah.
that need. I mean, I don't. This sounds ridiculous, and I've never actually double checked it. You tell me. But at the first treatment center I went to, they said that you would experience, and people don't talk about post-acute withdrawal much. I don't think. I think people should talk about it more. But that you would experience 6 months of post-acute withdrawal for every year you had been using up to so many years. Maybe it was like 2 or 3.
So,
But my experience hasn't been that it would last that long.
yeah, so let's look it up. Symptoms of post-acute withdrawal syndrome.
I imagine they vary wildly too.
They do.
From person in their circumstances. Because my experience has been that post-acute withdrawal is really driven by nervous system malfunction, which can be driven by stress and anxiety too.
It's not bringing it up. Mood swings, sleeping problems, fatigue, craving, difficulty concentrating. But there are like, okay, wait. Of course. And it's Betty Ford, of course.
And I'm sure though that post-acute withdrawal is going to be worse for certain substances.
Sure. So look, the architecture of the prefrontal cortex starts changing almost immediately. But what actually needs to happen is the reinforcement of new neurological pathways. And even on a biological level, post-acute withdrawal syndrome typically, I mean, they say it like monolithically even that post-acute withdrawal syndrome will never last for more than 2 years. It just, for whatever reason, biologically, like the brain repairs itself and the body repairs itself to the point where you are no longer having these symptoms. But Dr. Shah is the only neurologist in the country that's also an addiction medicine specialist that's in personal recovery. And his whole model is built on like the neurological effects of addiction, substance addictions, right? And even some like process addictions affect the brain wildly, like pornography addiction and like stuff like this.
Was it on your show? I heard somebody recently say that like the dopamine hit you get from pornography is like 120. I don't remember this. It was
Yeah.
way more than anything else you get dopamine from.
Yeah. So so in addition to the dopamine response, right, there is like architecture. They've done millions of brain scans, right? There's a doctor, his name is Dr. Amen. He scanned all of the celebrities. Millions of brain scans, just this one guy. And something that he talks about is the architecture of the alcoholic brain is fundamentally different than a normal brain. Like there's actually differences in the structuring of that component of the brain, but it isn't permanent, right? As long as you haven't done like tissue damage to your brain, it can repair itself, right? And this is the one of the beauties of psilocybin is that neurogenesis happens at like 1,000 times greater under the influence of psilocybin than anything else.
Yeah.
Right, and it's like there is really really good studies that have been done around this, right? Where it's like the effect of the person in recovery microdosing or even going on like these they call them like journeys or whatever with psilocybin and the actual neurological benefits to that person. Do you know how you build new neurological pathways?
I mean, I think you just build them through, like, it's like, putting a new groove in a record. You got to keep walking a different path
For sure.
over and over again. And then
But do you know
finally-
how the pathway is initially made?
No.
When Dr. Shah told me this, it was like one of the craziest realizations I've ever had. He said, every time you have a new thought, you've built a new neurological pathway.
You don't even have to act on it?
No, the neurological pathway gets made with the thought.
Oh,
It's the
wow.
reinforcement of the thought that has to be done, right? So it's like, think of those cartoons where it's like they're walking back and forth and then it like fast forwards and they're like up to their neck now.
Yeah.
That is what happens with the action behind the thought. We reinforce it and it becomes this groove, right? Where our first thought typically will go on, like it's an electrical signal that goes down the path of least resistance, right? So
Right.
what is the most well-worn path for us? It's our use.
Yeah.
It's our abuse. It's all that stuff, right? And so the thought builds the pathway, and now it's up to us to intentionally reinforce the thought. And now he says it's like a river, right? Rivers diverge all the time. And once it gets to that point of being diverged, it will choose that path every time. And so you have to reinforce it to the point where it diverges. And now the thought is still possible, but it's less likely to be the signal path.
That makes me think of people that are sick or like have cancer and then they sort of heal their bodies with their minds by just practicing every day that they're telling themselves they're not sick or that they can heal or something. That it just creates a thought to start the new pattern recognition. I don't know, maybe the brain obviously is really powerful. Maybe there's a lot that we don't know that we just can't possibly understand.
It's interesting, right? Because it's so either everything exists on a spiritual plane or it doesn't. Okay, so it either is or it isn't.
Right.
And if it is, right, this is where the concept of miracles makes sense to me, right? Because it's like there are if this physical realm is also kind of governed by the spiritual laws, then I think that it is absolutely possible to have like a miraculous like healing.
I do too.
Okay, so if that's possible, and our brain is kind of the like conductor for our spirituality, then why isn't it possible for the brain to kind of start this process? Right? I personally believe that like every recovery is like a miraculous situation, right? Where it's like, for all intents and purposes, we shouldn't recover,
Right.
right? And so for when we do, and with the presupposition of like that everything exists spiritually as well, it's like, where did it all start? It's like all starts in the mind, which isn't actually measurable, which also you can't put the mind under a microscope. You can't actually identify where the mind is. There's assumptions around where it's centered, but we don't actually even know. They used to think the mind was in the heart.
Really?
Yeah.
I didn't know that.
There's actually some really, really crazy.
Tell me about that. What?
Yeah. Oh, yeah. For a long time, they thought that the heart was the center of the soul and mind. For probably thousands of years, they thought
Oh,
this.
I guess that. So, like Vedic traditions, even Buddhists still believe that when you die, all of your energy returns to your heart chakra, which is why they leave the body for several hours, because they're trying to give you the process to allow that to happen. So, I wonder if that's part of where that comes from.
So they found actually that there are, fuck, now I'm gonna forget what they're called. There's a component, like a core component of the brain, where there are actually more of these things found in the stomach and the heart than in the brain. Right? They're like the nodes that like your electrical signals travel on. Right? And so it's like, why when you are nervous do you feel it in your stomach? Or why when you are in love you feel it in your chest? Right? It's like, there's obviously some kind of connection.
Yeah. Yeah, you do feel pain, heartache.
For
heartache,
sure. For
right?
sure.
Yeah. And I do know that the gut is, a huge driver, I think, even of our behavior.
Oh, yeah.
I
Oh,
mean,
yeah. Have you seen these studies on like flora, like microflora and like,
Yeah.
dude, if it is like off balance at all, like you're making terrible decisions. Well, it's like that thing that goes on with cats.
Oh, toxoplasm.
Yeah.
Yeah.
Toxoplasmosis.
Plasmosis.
Yeah. I mean, it's just so, or because you know why they do that, right? Like what toxoplasmosis actually is.
I just know that it's a virus, and I don't know what the purpose of it is.
So it attracts rats to their piss.
And how does that benefit them?
Well,
because they can eat the
yeah.
rat? Oh, wow.
Yeah.
So it's literally reprogramming the biology of a rat. It sounds like
Hijacks their mental processes.
Yeah. Sounds
Yeah.
like something mold would do, or fungus.
That's funny
Yeah.
because have you seen that Cynthia episode?
That was an older episode,
Yeah,
right?
yeah. Dude, she's like, anyway, yeah.
Dude, mold is a big deal. Like I'm
is.
kind of obsessed with that stuff too. And I had a mold exposure. I think I told you I had like a 10-year black mold exposure.
So crazy.
And I know, and I have checked with literally multiple doctors, telling them that I think because I've had all these sort of neurological issues during coming off of methadone this time that I didn't have last time. And I was like, do you think this is because of the black mold exposure? Because it brought up all of that stuff. Like, some of this might be normal for like end stage methadone taper, but light sensitivity, sound sensitivity, my ears just ringing all the time, feeling like my entire body was buzzing. And this went on for weeks. It still goes on. So I really feel like, because these were a lot of the same symptoms that you get from mold toxicity. So it either means that mold toxicity, the symptoms never really go away, and I don't know if that's because the mold never truly leaves your system.
You should talk to Cynthia.
Yeah?
Yeah, because this is actually all she does now is like treats mold, like damage from like neurological damage from mold. And what she said is that there's actually like, so there's heavy metals like that we are fundamentally made out of, right? And she was like, most people think that heavy metal exposure is just like uh, negative by nature, right? She was like, typically what happens though is you become deficient in heavy metals with mold exposure. And so
Huh.
you have to replenish your heavy metals.
Interesting.
And that all symptoms are, from mold exposure specifically, all symptoms are, that you can alleviate all symptoms.
Oh, wow. That's interesting because I've worked with two different functional doctors around that, and they've never been able to fully
Yeah.
manage it.
The problem, doctor.
Yeah.
Yeah, that's the problem.
I mean, functional's supposed to be a little better, but
I mean,
they're supposed to be hip to that kind of stuff.
yeah, but I mean, what does that actually
but
mean?
they're still profit driven and very expensive.
Yeah, but also, what does it actually mean to be a functional doctor? What does that actually mean in practice? Maybe a few months.
They don't know. They don't. Oh, I don't know. A lot of functional doctors I know are like chiropractors too. So
Oh
I
yeah,
think that
they're already quacks.
So I think that the other thing about functional medicine is you end up going to a functional medicine specialist hoping to cure or whatever because you're like, well, these Western doctors have mental.
There's no money
But then
in cures.
when the functional doctor just says, well, you've got to come see me and go on this protocol for an indefinite period of time,
Yeah.
and then next thing you know, 2 years later, you're still going into the office going, well, I've still got this symptom and this is, and then they're still trying to adjust your diet. And it's like, I don't know, at a certain point.
And next thing, like, really at the tail end of that, you're like eating cream of wheat for breakfast, lunch, and dinner.
Well, no wheat. You're literally just eating like plain chicken breast and like
Kale.
beets or something. Yeah.
Gross. I couldn't do it.
And then
Like,
you got to keep doing that for a while, right? And then if you have any food cravings, oh, that's just because your gut is still off. Like you just have to keep going until the food cravings stop. I've done so many elimination diets. And I don't even eat. I've never been a big carb person, but the first time I did an elimination diet around this mold and inflammation, I started having the weirdest cravings. I would go into the store and just like see a box of Oreos, which is not something that I enjoy. I'd be like, oh my gosh, Oreos. Like you can feel your gut telling you what you want to eat before you've even.
this is interesting. So we're going to switch gears kind of. But cravings, like drug cravings, right? I've never craved a drug where I've craved it like a food, right? Like
Me either.
no one has.
I don't have. When they talk about cravings in a classical sense, I'm not really sure I've ever had I don't.
Nobody's ever craved drugs. It's a colloquial thing that we use to kind of describe a phenomenon that fits kind of the same way. But ultimately, what we did was we allowed the science community to attach a descriptor to something that is completely inaccurate, so that other people understand. It wasn't for us; it was for the family and for whoever to kind of understand what's going on. That like, oh, they're craving the drug. It's not a craving.
Cravings are interesting to me because I feel like by the time I am craving a drug, I'm already done. Like if I'm craving something, I've already decided I'm gonna go. That's how quick my process is. Like it lasts literally
24
seconds.
hours.
No, less, even less. Like something happens, I go, oh, drugs are the solution. And then there's actually not even a craving process that happens. It's just a decision made in a snap moment. So
Yes.
I've never really understood the cravings part. Like this time was the first time I took a prescription to naltrexone, and I've had experiences with Suboxone in the past, but and I know naltrexone is not the same thing as Suboxone because it doesn't have the buprenorphine. But I in the past have always turned down anything like a Narcan or a naltrexone prescription, or what's the implant, the Vivitrol.
Vivitrol.
Yeah. Because I just felt like
Vivitrex is like the brand name, I think.
Maybe. So I just felt like it wasn't necessary. But then this time my methadone doctor explained to me, well, I don't want you to take the naltrexone every day. I'm just going to give you a prescription for it. Get it filled. And then if something does happen one day, if there's something that makes you just decide you're going to go use, instead of doing that, just take a naltrexone, and then that'll buy you the 24 hours. I think anybody that, at risk of upsetting some people, I think anyone that needs to be on naltrexone 24/7, well, here we get back to harm reduction, because that's not really going to keep people happy. It might keep them clean, but it's not going to get them back to a place of finding meaning or purpose. It's just going to be this constant cycle of, oh, I have to get up and take this pill so I don't go use. And then what if I ever don't have this pill? Then am I going to be deficient somehow?
Yeah. The interesting thing about drugs, prescription drugs, is that we go, this is a religion, right? The medical industry is a religion ultimately. And we go to these like priests of the religion, which are the doctors, right? And we go to these priests for these solutions, right? And what we end up doing is taking it as gospel that what this doctor has told me, the priest of this religion has told me, is that this is gospel truth. And what a doctor recently, I don't even want to say the name of the doctor, but what he recently told me was that like most of these prescriptions should be taken as needed. They should not be taken every day, unless we're talking about like psych meds and stuff like this, where it's like most of these drugs should just be taken as needed, not like a daily thing. Definitely shouldn't be like in your system indefinitely. Like these are the funny thing about drugs is that like people talk about side effects. There is no such thing as a side effect to a prescription drug. These are just wanted or unwanted symptoms of the chemical, right? There is no side effect. This is an effect of the drug that they call a side effect because they want you to focus on the primary effect.
Yeah, that's a good point. Like blood pressure medications are a good example of that. People will not feel well on a blood pressure medication, or they'll feel tired, and they'll say that fatigue is a side effect. No, having a low blood pressure is a result of taking a blood pressure medication.
For sure.
And sometimes if your blood pressure gets too low, you're going to feel tired. It's actually a wanted. I mean,
it's what it's made to do.
Yeah.
It's just now you are effectively overdosing on it, right? There's so much built up in your system, or let's just say your blood pressure drops naturally, and now it's dropping to unnatural levels because you're on these suppressants.
Right. Yeah.
Right. And so like with naltrexone, what's interesting to me is that all of these drugs were built around the phenomenon of craving. In my opinion, cravings don't exist the same way that a craving for food exists. Like when you're craving a food, you can almost taste it. You can feel it in your body, right? When you crave a drug, these are mental phenomenons, right? Where it's like a lot of it has to do with thought processes, but then also coping skills, where it's like a thought supercharged by an emotion causes action, right? So if you're emotionally unstable and have a thought, it very quickly turns into action, right? But if you have like, you're emotionally grounded, you've created these coping skills, you're now using them effectively, and you have this thought, that is all it'll ever stay, is a thought.
Well, that's like responding versus reacting.
For sure. Well, and then so it's like you are not responsible for your first thought. You are responsible for your second thought, right? And so if your second thought has been trained to cope correctly, then relapse is almost never an option.
Right.
Right?
Yeah. You can then face all of that crappy stuff and know that you're going to be fine.
Yeah.
And that's why I think it's okay to be in charge of your own recovery. Like I don't.
Yeah.
I mean, is that an agreement or a disagreement?
No, dude, let's go back to this. Self-directed.
Yeah.
Right? Like the problem is that most people are depending on a sponsor or somebody else to tell them what to do.
And I gotta say it. sponsors are also just other drug addicts in recovery.
They're also super unqualified.
Yeah. I I know that some people in AA will go and get peer support, like the certification to
Sure.
do peer.
I certify peer support specialist.
Okay. So those people might have more of a, they might be more helpful, but like we'll circle back to the dry drunk that actually just thinks that they know everything and are also willing to sort of exert their control over the other addict as any situation that they would.
Yeah. So here's the delineation. So peer support is fundamentally in conflict with the 12-step model for multiple reasons. And most of it has to do with returning autonomy to the client versus like making them dependent on another person, right? And I'm not, again, this is not to say that AA doesn't work or that it's ineffective or that it's a cult or anything like that. What I'm saying is that AA was created to give you your life back. It wasn't created to give you a new lifestyle, right? Like, and so there's two people that end up in AA. There's people that need it, and then people who that's become their lifestyle, right? And for the people that it's become their lifestyle, they will probably stay sober forever if that continues to be their lifestyle. But I know people that have lost their entire life in those rooms. Like they never progressed professionally with their families. Like that became their life, right? And I'm not saying that it's wrong, but for the example that I always use, because I heard this, was the guy that had 30 years in the back of the room saying, well, I just didn't drink today, so that's a win for me.
Well, it's like it's just another kind of cult, and in a way, because I feel like, you can, the people that just go to the rooms for 20 plus years and that's it, and they're still not working on any like advancing any other part of their life. That's just going to the rooms. That's their entire existence. Identity. Yeah, that's their entire identity. And that's kind of why I said it's cult-like, because that's why people join cults, is because they are searching to be a part of a larger identity. They're sort of lost. They don't know what their own identity is, and they're looking for that in a larger group to be part of the whole.
Yeah.
And I think that there are people in the rooms that do that even after being sober for a long time. They're still just looking for a place to belong.
Yeah, I agree. I also want to say that the tool is fundamentally and like ontologically neutral. AA in and of itself is neutral.
Yeah.
Right? The 12-step program in and of itself is neutral. Right? And so it's up to, like, is the operator's responsibility to dictate the outcome.
And to be fair, I think proper step work is maybe the only thing that has helped certain, addicts. No matter where they do it, who they do it with, how they do it. I don't know anything that's been more helpful to me. I mean, we'll call it step work, but it's really just picking apart your behaviors and understanding why you choose, do, prefer, resent, all types of things. And then through understanding that, you can take a snapshot of how you could act in the future, and then you get to decide whether or not that's what you want to do.
Yeah, I mean, it's the whole returning the autonomy back to the person, right? The problem is that in those specific frameworks, they like systematically rob people of their autonomy. Like their decision making is all based on dogmatic belief systems.
Well, and they definitely, I mean, yeah, it's dogmatic, and you rob people of their autonomy just by telling them that there's an A, B, C, 1, 2, 3 clean step to all of this. When even when you follow A, B, C, 1, 2, 3, I don't think it's necessarily as clean cut as all that.
It's not, but it is a really good framework.
It is. And it's really, I think, just another form. It's like the street form of cognitive behavioral therapy.
Well, it's programming.
Yeah.
It's exactly what it is programming.
Yeah.
You know, and I don't think there's anything wrong with program. Especially, a lot of us are maladjusted, antisocial. Like, there's a lot of antisocial behavior, at least. And this effectively was what we used as coping skills.
Yeah, and I think if we weren't antisocial before, we certainly were after.
In use.
Yeah.
Yeah. Oh, that's what I'm talking about. Is like the addictive behaviors kind of have a tendency to create antisocial behavior patterns, and unless you break these patterns, you will carry these patterns into your recovery too. And I know plenty of people that do. And most people do, especially early in recovery. It's like you're still trying to fuck the girl. You're still trying to lie about this. You're still whatever, right? It's like you have to systematically break all of these things down. And that's where the step work is massively effective. Is it helps you deconstruct all of the frameworks and systems that you've built in your life to keep you surviving.
I also think community is really important. And you can find community in a bunch of different ways. And
For sure.
I understand that people find community in the rooms.
So one of my favorite things to say is that treatment happens in facilities, recovery happens in community.
Mm-hmm.
Right? So effectively, and this is a Dr. Shaw like staple around what we're doing, is that if you do not find community, there's a high likelihood, like not just community, supportive community, understanding community, like also community that holds people accountable,
Yeah.
right? Like if you do not do that, it is still possible for you to enter recovery, but it is much more difficult, like much, much more difficult. And so we always point people to the rooms because it is effective, because it does put you in that place to be able to foundationally build while, because it blows my mind that this happens all the time. You send a person to treatment, they're there for 28 days, and then you send a healing person back into a sick situation and expect them to continue to heal.
Yeah.
It doesn't make sense.
No.
So if they are going back home, if they are going back to wherever that they came from, and they don't have a community piece, you will see them again.
And I think a lot of people search for that community piece in the wrong place.
For sure. But,
know?
I mean, understandably so, right? Because it's like when you don't know how to find it, like, how do you actually do that? Like, how do you, okay, put it to you like this. For somebody in early recovery, where else can you go and find a community of people that understand your struggle, that are supportive of your recovery, and also have been there and done that themselves? Where else can you do that?
Nowhere really, but you can't even always do that there.
No, you're 100% right. But the chances are much greater that you will find one. Like a room, a group of people. And this is why I tell people, I hear it all the time, AA didn't work for me. And it's like, okay, well, how many people did you sponsor? I'm like, well, I didn't get past the third step. It's like, you didn't even do AA.
Yeah. I've been circling this for myself because I've already made a decision about, or I thought I'd made a decision about the rooms when I stopped going. But I have noticed this time that I could potentially benefit from another community of people in recovery.
Sure.
For the accountability piece.
Mm-hmm.
And people that then don't find it in the rooms, like me, end up searching for it other places. That's how I ended up in a cult, really. We'll just go there. I mean, because I didn't go there looking to belong. I went there looking for tools, and I didn't know it was a cult at the time. I went there, it started with me just taking some retreats, some silent retreats and some meditation retreats.
Mm-hmm.
And then when I did find community there, and I even found some understanding.
When you found community in silence.
Yeah, that is interesting. But because you're all silent, but there's a group of you there, so you kind of feel like we're all. And ironically, a lot of people that end up at places like that have dealt with a lot of trauma, and there are a lot of addicts there. There are a lot of people there that
Dude.
have just gone through like losing a spouse, or they're all seeking something. And the the dopamine that you get from that, from feeling like you're totally at one with a bunch of people that you actually don't even know that much about and you're not speaking to, it makes you feel like you have some inherent value that you didn't necessarily see before. Like these people recognize, you just, I don't know, you feel like you belong, and it's very easy to suck you in. It's very easy to suck you in, and that's what happened to me.
So, have you ever seen this?
No.
They're cartoon.
Oh,
Dude, this is one of the most. I mean,
that stuff is all, yeah. I mean,
you should watch this documentary. It's really, really interesting.
I'm going to.
Yeah, Into the Great Silence. And it's funny because when you said that, like, you found community in silence, there is so much convolution of intention and meaning in language, right? And it's like the only way to deceive somebody is with your mouth,
Yeah.
right? Oh, I mean, like you could do makeup and like whatever, right? But like the easiest and most obvious way to deceive somebody is with your language.
Sure.
And so it's like, it's not ironic to me that you found community in silence. Because one of my really good friends is like devoutly Catholic, and he goes and spends time like with monks in monasteries all the time. And we talk about this all the time, how powerful silence actually is.
Yeah, I truly believe in that. And that's part of why I'm going on this little pilgrimage this year. I'm trying to find that in a different sense for myself. I'm trying to.
You're going to Tibet, right?
Yeah.
Have you seen these? So in Tibet, they've got these like spiritual retreat type things where you go up into these caves by yourself.
I didn't know that.
Dude, so this is what it is. They put you in this cave and they like roll a rock over the entrance.
Like Westerners can go there and do that?
I believe so. I think I don't remember like exactly how you get involved with this, but like once you get there, like you go up to this mountain, they roll this rock over this entrance, and then like after day 2 of like complete blackness and no eating, they give you like psychedelics, and then they roll the rock over it again, and then you're there for like a couple days, and they come and give you like tea and then you're there for a couple more days, and they come back and give you more psychedelics, and it's like this supposedly it's just this super insane experience.
It sounds like it would be super intense.
Yeah.
I mean, it sounds like some form of a, what did they call that? The Native Americans, the spirit quest, where they would just send. It sounds like a good way. I mean, this is like man's meaning to life or whatever, like having to go through these huge hardships. And I think sometimes it is true that we have to literally create those hardships for ourselves, and so something like that seems extreme, but I don't know, maybe it's not so extreme.
I mean,
it actually sounds like something I would do.
Yeah.
Honestly.
Oh, dude, trust me. So one of my best friends, he's in prison right now, and he talks about this all the time. Like I believe it. He's gonna do this, like when he gets out. The thing about today's day and age is, especially for boys at least, I don't know what the equivalency of this would be for young women, but like there is no coming of age ceremony anymore, right? Like you turn 18, you can vote.
The closest thing I could think of it to men would be like if they joined a fraternity and got hazed. But that's still older than a young kid.
No, what I'm talking about is like community-based ritual.
Oh.
Yeah, like like the community that you were raised in now accepts you as a man, right? The closest thing that I know of for sure is like in the Mormon community, they serve missions, right? Where
oh, yeah, okay.
When you're 18, you go for 2 years to a foreign land, you learn a foreign language, You get doors slammed in your face 9 times out of 10. I mean, you learn rejection, leadership skills, all this stuff, right? And then when you come back, you're literally respected like as a man, right? Like this is like a true coming of age in today's modern society. But this is missing like almost monolithically throughout our society, that like there is nothing like this anymore. And then you just kind of you evolve from like childhood. And I mean, you dated men, so like how many men did you know were actually boys in men's bodies?
I mean, I think most men I know are actually just boys in men's bodies.
Okay, I would tend to agree that this is a systemic problem, though, that there is no actual like definitive moment where you become a man, right? And I think that like mentorship and like all this stuff plays a lot into that. There is none of that. Also, you know, like a huge component of men today are growing up without fathers, right? There's all of these, you know, sociological, political things that play into this, but this is the downstream effects of it. Is like a woman like you, her dating experience is that the majority of men that you know are boys in men's bodies, right? This is the downstream effects of the destruction of like the family unit, like a bunch of stuff, really.
I really believe in that. Like I said, I'm not religious, but I believe in like Western values and the values of family systems, and I think that it's impossible to say that those things don't have a place or that they don't have meaning, and especially I think maybe they have even more place and more meaning.
Yeah, well, you said Western. The reality is these are just core traditions, human traditions, like family tradition, like parental obligations. Like nowadays, dude, it's
Well, nowadays everything's outsourced, and who wants to have to deal with that with someone else's kids? Not a lot.
The outsourcing kind of presupposes that they're actually there. Most parents aren't even actually there.
They're not even there to outsource.
Right. It's whether they're not present in the home or they're just not present mentally or emotionally, they're just not there.
Yeah.
Right. So again, this is just downstream effects of like really smart rich people understanding like how they can create infighting to keep power.
Yeah. Yeah. I mean, I think that as a culture, you know, we started this podcast talking about whether or not the rise in addiction was like a social issue. And if you look at it through this lens, it's obviously a social issue.
Okay. I think it's socially propagated, but I think it's an individual issue. And there's really a really good case study of this going on right now in California. They, in 2019, created a $24 billion package. And the whole idea was they were going to end homelessness. And the way that they were going to do it was they were going to throw money at it. And 5 years later, they're starting to do like all the outcome studies and stuff. They doubled the homeless population.
Throwing money at problems is not generally a good way to fix it.
For sure.
And you see, like, we'll talk about codependent parents. I mean,
Oh, yeah.
You know, they love to try and throw money at problems.
I've got a theory about that. I think that codependency at its latest stages will always manifest in one of two ways. It's either time or money. And there's clear-cut reasons why they would spend time or clear-cut reasons why they would spend money. And it's typically they have no money, so they will give them their time.
Or they have no time.
Or they have no time, and they will give them the money, right? And ultimately, all they're trying to do is make themselves feel better about what it is that they did not do.
You are so right. They're ultimately trying to remove any guilt that they could potentially feel in the future.
No, they do. It is that they do feel, because ultimately the failure of a child is ultimately the failure of the parent, right? Like whether that's true or not, in that parent's mind, that is always true.
Right.
So there is going to be guilt. There is going to be shame. There is going to be what ifs. There's going to be these things that play into why their actions are symptomatically like manifesting the way that they are, right? And so for the codependent parent, you know, and then there's other things that kind of play into it too. It's like have they robbed you, and like has the child literally stolen from you enough that you will not give them money anymore, and now you will only give them time, right? Or have you been so unpresent that the only thing that you think will help is to give them your time, right? It's like ultimately there's like factors that are going to play into why you're giving time or money, but it's only those two things that end up happening.
Some parents literally aren't even able to be emotionally present enough to give time. I mean, and it's not just that they don't have time. They could have actual physical time,
Right.
but they
They don't know
have
what
the
to do with the time.
emotional capacity.
For sure.
Yeah. And so money, I think, is like you said, it's the next closest thing.
For sure. And it's like, so you either love with your time or you love with your pocket. The problem is that both of those things are still contributing to the problem. Because if you are giving them your time, you're negatively reinforcing the behavior. If you're giving them the money, you're definitely negatively reinforcing the behavior. So this is where, kind of to circle back to the conversation earlier, there has to be discernment and education based on the experience in order to realize what is or is not going to help. And ultimately, in these late stages of codependency, I always will tell the parent that it is time for you to draw boundaries around what the outcome, like you need to dictate the boundary by the desired outcome. And so codependency, if those are the two last manifestations of it, then what needs to happen is emotional support. I will be here for you emotionally. I will talk to you. I will help you in any way that I can, but I will not give you my time and I will not give you my money. Like physical time.
Yeah. I think that I just look at my own history, and the adults in my life have been so shut down. Like when I was younger, the adults were just so
unavailable.
You know, I didn't even have any huge, like my mom was an alcoholic, but I had everything physically that I wanted. Like we were a middle class family. My dad had a good job, but he was never there. It was always about the money. Like he was so concerned about making sure that, you know, there was food on the table, that you had this special toy or this whatever. And I literally look back at my childhood and I just never saw my father. And what is his solution to that, though, as I've become an adult, was to
completely rebound the other way.
Yeah.
So at the risk of offending a lot of people, which I talk about this all the time anyway, but I think a lot of this can really all be traced back to women's suffrage, like the women's suffrage movement.
Tell me how.
So they were looking for a way to double the tax base and also cheapen labor. Like ultimately that was the decision, because how does a group of people gain the right to vote if they cannot vote?
Yeah, I don't know.
Okay, so obviously
you have to campaign with some, you know, some leverage.
How do you campaign if you have no money?
With compromises, I don't know.
I mean, so
yeah, I'll give you this if you give me that.
Ultimately, and the trade-off was this: we'll find these women that are whatever, right? They found these women that could be placeholders for their agenda, right? And ultimately, it was a bunch of rich people that funded this thing because they wanted to broaden the tax base and cheapen labor. So now we're going to double the workforce, and we're going to double the tax base.
I had no idea. And that, like, they're still doing the same thing.
Well, these are all downstream. What's going on today is downstream effects of removing the mother from the home and paying the father less.
Wow.
Mm-hmm. Because back then, a janitor for a middle school could afford a 3-bedroom home, 2 car payments, and food on the table, and not have to work more than 40 hours a week.
Yeah, you could actually support a family.
Right.
On a much lower wage than you can today. I mean, now people are struggling to support themselves. And that's a whole, you know, that's another conversation, is the stress of finances, the stress of making it in this economy.
All downstream effects of giving. And here's the other part that a lot of people like kind of fail to correlate is that when this country was established, a very small amount of people actually could vote, right? It was landowners. Didn't matter if it was men or women, right? Landowners and people who had fought in wars. They were the people that were voting, right? And so that was a very small amount of people. Now you give everybody, like universal suffrage, right? Universal representation. Now this is where you see things like the 45-year-old dad votes one way and the 18-year-old daughter, who's an OnlyFans model, votes the opposite way. And now it just completely negated the dad's vote, who has a stake in the economy, who has a stake in the social outcomes, who has a stake in all this, right? But and most people are just fundamentally uneducated. Like, they are going into these voting booths voting with their feelings, not with their education.
Or they're just not doing research, period. You know, voting for who someone else tells them to vote for.
For sure.
Something like that.
For sure. But all of this, and addiction is heavily tied to this. Addiction is exploding because of people's complete lack of purpose.
Mm-hmm.
And I think a lot of this just really can all be pointed back to like this fundamental moment where things just really deteriorated socially.
Lack of purpose, and also I feel like it's a boiling point for society, especially right now.
Yeah.
I don't think he would mind. I won't tell his name, but I have a friend who has been a motorcycle mechanic and a welder his whole life. Owned a motorcycle shop. Last August, he was in a motorcycle accident, lost his arm. Mm-hmm. You would think this man would be absolutely devastated that he lost his arm. Instead, he felt nothing but relief. He felt like he literally described this scenario of about to be getting in this accident, knowing it was going to happen. And he hit a guardrail, and that's what the guardrail literally took his arm and almost took part of his leg. As this was happening, he could see it happening, and he said everything slowed down. He did have a leaving his body moment where he hovered above himself, but he remembers nothing better than the thought of, this is going to hurt really bad, but it's going to be worth it. And his thought process was just like, I don't have to worry about this superficial stuff anymore. I can put down I can stop worrying about, having to keep the shop open for all, these just things that didn't actually feel like they brought him purpose. And so he just immediately saw it in this whole new way. I think a lot of people don't really understand how somebody could feel that way, but I kind of get it. The relief of knowing that you don't have to contribute to something anymore that is not bringing you any real purpose, that it's just something that you feel like you're performing for society, that relief can be so great that we're willing to trade an arm for it.
Yeah. That's
crazy. The lesson,
Yeah. Well, shit. That's crazy.
It is crazy. It's a pretty crazy story.
I get it, though.
Yeah.
I really do. Well, all right. Thank you for coming.
Yeah.
I really appreciate it.
I'm really glad. It's really nice to be in Houston. It's not as ugly here as I thought it was gonna be. We talked about how it's super flat like Florida and stuff, and all of the lack of plants, but I think maybe I've been in the downtown area enough just to see all the laurel oaks and like the laurel on the ground, so I'm like, it's not as bad, but definitely once you get on the freeway and stuff, I know it's just a flat concrete jungle. So, but yeah, I really appreciate the opportunity to come talk to you while I'm here.
Dude, this was a long time coming.
Yeah.
Yeah, I think you were like one of the first people that expressed like that you wanted to come on.
Yeah.
I think ever on this show.
Oh, really?
One of them, yeah, like maybe one of the first 5.
I don't know. It just seemed like a good move for where I was at in my life and what was going on.
Yeah, Well, I'm glad you came.
And I think what really drew my attention to your podcast, because you talked about it early on, was just, your experience with medication-assisted treatment. And I really appreciated you sharing that narrative of feeling like you were being told to do something else, but it still worked out for you.
Yeah. Yeah. I mean, I've hammered on this, but ultimately I think that there is, for some of the most educated people in the world to be so uneducated about what's going on, it blows my mind. And so it's like, I think that we owe it to other people that are going through that struggle to kind of really break down what's going on. Because also, again, I said, like, it's a religion. Like, the medical industry is like religious, and we're going to these priests of this religion and we just take it as gospel. But they are bound by licensure and legalities and liability to do something very specific, but it doesn't mean that it's the right thing.
No. And they couldn't possibly know what's the right thing all the time.
Yeah, well, who was it? Anyway, somebody reached out to me and was like, a doctor told me to listen to your podcast because I'm going through...
oh, wow.
Yeah. It was in Pennsylvania. This girl reaches out to me and said, my doctor told me that he can't tell me what I should do at this point because of his license, but to watch your podcast. Wow. And so that's how she got off Suboxone.
That's awesome, but that's also crazy.
Yeah.
That her doctor actually admitted that. Yeah. Good for him.
Yeah, I mean, hey. Well, all right. I appreciate your time, and I appreciate that, dude, I think you might have the record for coming the farthest to be on the show.
Awesome. Well, I had 2 reasons, but it was great. Yeah.
All right. Thank you again.
Yeah, thanks.
Thanks for listening to My Last Relapse. I'm Matt Handy, the founder of Harmony Grove Behavioral Health, Houston, Texas, where our mission is to provide compassionate, evidence-based care for anyone facing addiction, mental health challenges, and co-occurring disorders. Find out more at harmonygrovebh.com. Follow and subscribe to My Last Relapse on YouTube, Apple Podcasts, Spotify, and wherever you like to stream podcasts. Got a question for us? Leave a message or voicemail at mylastrelapse.com. If you're feeling overwhelmed or struggling, you don't have to face it alone. Reaching out for support is a sign of strength, and help is always available. If you or anyone you know needs help, give us a call 24 hours a day at 888-691-8295.